afternoon, good evening, everyone, and welcome to this edition of Fever Foundation quiz. We are playing for the South Zone today, and this is the first ever quiz on only related to fever related condition. And thank you all very much for registering and playing the quiz. So before we actually play the quiz, I'm going to tell you about some of the rules we need to follow during the playing of this quiz. And so we had already sent you by mail, but I'm going to tell it once again so that you'll become familiar with all the rules and regulations. The first is the quiz is for postgraduate students only. The quiz consists of multiple choice questions. There will be 20 such questions in this quiz to answer, and each question will have 20 seconds to answer. The option to be selected by clicking on the bottom on the text panel. See it, so the button on the text panel. So you have on the right hand side of you, there is a text panel. You need to use the options which is displayed there and click the button to submit. The video what you are saying will be only just for representation purpose only. You cannot click the button on the video, so you need to use the text panel. And I request all the audience participants, you have been advised here not to leave this platform and enter the YouTube. YouTube link we have given only for viewing. You cannot select any option. So for you to participate in the quiz and complete the quiz, please stay on this platform only. And please note that once you submit the answers, it is not possible to revert it. No negative marking in this quiz. And the winner will be on maximum fast right answer. That is, fastest right answer will be considered as the winner. And if in the event of tie, there will be a tiebreaker round. There will be 3 questions which will be done to decide the winners. And it is advisable to use your laptop and desktop for a better opportunities or better feel of displaying this quiz. Next slide, please. And also we advise the participants to place the play in a place where there is a good internet connectivity. If found to be any type of foul play, so your candidature will be automatically disqualified. And you should not use mobile phone for getting answers from any of your colleagues sitting nearby. And Fever Foundation is not responsible for any form of technical error, such as poor net connectivity, etc. And participation in the quiz implies that participants accept the integrity of these rules. And the participants who have given incomplete or inaccurate personal and contact details will be disqualified. And also non-compliance with the rules results in the automatic cancellation of the participation in the quiz and of the candidacy of the prize. And please note, first and second winner of this South Zone from each zone, which applies to South Zone as well, you will enter as a team for the national level quiz competition, which will be during the FEFCON 2022, which will be in Bangalore on November 5th and 6th. That means you will be represented. Currently, you are playing as an individual, but in the national level, you will be playing first and 2 person. Second winner will be playing as a team, and you compete for your zonal championship at the national level. And finally, quiz masters and judges' decision will be final, and all of us are going to bind by this. So I wish you all the best for this quiz. May the best student win the quiz. Before we start the quiz, I would like to introduce our judges and the quiz master for today. The first is Dr. Professor T.U. Sukumaran, sir. Sir is MD, MNAMS, FIAP, MPhil, and PhD. Sir is a former professor and head of the Department of Pediatric, PIMS Tiruvalla. He is a past National President IAP 2011, National President of IAP Respiratory Chapter, National President of Allergy Immunology Chapter, and Best Doctor Award for Government of Kerala, Professor of Pediatric in various government medical colleges, and he has written several books and edited 10 books during his tenure. Sir, it's our pleasure and privilege to have you here as the quiz master, sir. Thank you very much. So the second quiz master we have is Professor Dr. T.M. Anandakesavan, sir. He is the additional professor of pediatric at GMC Thrissur, IAP National Vice President 2020, past National President of IAP Neurology Chapter, past President and Secretary of IAP Kerala State. Is Editor-in-Chief of Indian Journal of Trauma and Emergency Pediatrics, Chief Editor of IAP TB of Pediatric Radiology, Frontier in Pediatric Neurology and Recent Advances in Neonatology. Is a member of National Advisory Board of Indian Pediatrics. So, Dr. Anand Kesavan, sir, it's our pleasure and privilege to have you here, sir. Welcome to you, sir. So now, since we have gone through this, all the rules and regulations and the quiz master, now I hand over the session to our quiz master and judges to take it over. Over to you, sir.
Good evening, everybody. I think we will go with the actual quiz. Before that, we'll have a mock quiz session. I request the computer to start the mock session. I request Dr. Anand to proceed.
Yeah, very good evening, my dear students. Wish you all the best to all the participants. Anyway, we know we'll have only two first and second winners, but I wish all the best to all the participants. As we all the it's a mock round dummy rounds. We can see that there are 4 options are there. Once the question is shown, you can click one of the answer and you will get 20 seconds. So those who are answering first, not right only, first will get the mark. So I think we'll start now. Our time start now. Computer ji. So out of this only one right answer. Now we'll ask computer for the right answer. A very obvious, simple question. So it is Google. All others are belongs to same category. So we'll see that.
What is the guess, sir? Yeah, I feel 100% would have answered correctly, I think, sir.
Yeah, it was a very easy question. 100%.
And no marks anyway. It's just a practice question. Yeah.
Okay.
Please show me the answering pattern. How many of them answered? Yeah, I think 95% of them answered the answer 3. That means Google. And I chose 1 and 2. Nobody answered. So very obvious. Our answer is Google. So who scored first? Now it is the last one.
Sir, for this we may not see. We will go to the next question because anyway they are not winning any prizes.
Yeah, now it is almost clear. I think we have 2 more dummy questions, Krishna.
Yeah.
2 more dummy questions, sir. Right. So please show the next questions. Computer ji, for next question. What is the scientific name for modern humans? So A, Homo sapiens, B, Homo magicians, 3, Homo technicians, and D, Homo genius. So Madam and Krishna made a question very simple. So your time start now. Computer. Yeah, I think almost answering is over. Now we request computer ji, what is the right answer?
Okay.
Yeah. So I think now we want to see the scoring pattern. How many of them have answered A, B, C, D?
Again, I feel same, sir. 100% will be there.
100%.
I think Madam has put very simple questions, no?
This is just for practice.
Yeah.
Yeah.
Yeah, one or two. So now you know it is very simple. So the only thing is that here the speed, that is very important. Right answer important. Second thing is that those who are clicking the right answer immediately will get the point. So both speed and knowledge is important here. That is the importance of this one. Not only the right answer, but the speed, because you 90% of them will got the right answer, but only one will get the prize. That is why we are saying that first click, that is very important. So your technical aspects also count here. Your knowledge-wise answer also very important here. That is the importance of this type of round. So we'll go for the last dummy question. I think now it is almost clear, but once again, we'll give one more. What is the most consumed drink in the world? Tea, coffee, beer, water. Here there may be some confusion. But time start now. Yes. So we can see the right answer. Computer J, mark the right answer. Yeah, universal. So colorless, odorless, and very our precious water is the answer. So now we see the scoring pattern. Computer J.
Yeah.
So, how many of them answered last water?
This also again 100% only.
100%.
100, definitely 100.
No, madam. Some
No,
of them
no,
are
my-
drinking beer also.
Main problem of the question is that people are confused with drink.
Yeah.
Whether to include water as a drink. Then we're talking about beer, whiskey, and things like that. So they
Yeah.
are confused now.
Drink means some other, that may be the reason.
Some
Anyway,
beverages.
it's a very, you can see that very simple, but once again I am saying that speed will count, but in a hurry don't answer the wrong question. I think now it is very, very clear. Once again, I wish you all the best. So we start the proper quiz round now. Yeah, our first question. All of the following are true of hypothermia except thermoelectric center setting is unchanged. That is answer 1. Answer 2 is not due to infection. Answer 3, succinylcholine causes malignant hypothermia. Fourth one, it usually responds to antibiotics. The 4 options are there. Your time starts now. Yes, but time over now. So we look for the right answer. Yeah, over to Sukuman sir.
Okay, it was a nice question on hyperthermia. Now we must know what is hyperthermia. Hyperthermia is a body temperature more than 103 to 104. And hyperthermia occurs when the environment temperature is high. And if you are doing a strenuous exercise, there can be a rise in body temperature. And you can see that the thermoregulatory center remains unchanged in hypothermia. And there's a condition called malignant hypothermia, which is mainly produced by an general anesthetic and some of the muscle relaxants like succinylcholine. And in malignant hypothermia, the temperature will be very high and there'll be muscle cramps will be there and there'll be tachycardia will be there. And most of the cases of hypothermia is not due to infections. So the correct answer will be D. It usually responds to antibiotics. So in hypothermia, the antibiotics are not going to be effective, and these children will not respond to antibiotic. And the mode of treatment is to reduce the environmental temperature by using ice packs or by using some ice cold IV fluids can be given to reduce the temperature. So there is no role for antibiotics. So the correct answer is D.
Yeah.
Okay.
Now we'll look for the answering pattern. How many of them answered right question and answer pattern? So here you can see that only 1/3 answered rightly, that is 29%, and the maximum number of questions answered from first and second, but the right answer is last one. It is not usually as Suman are rightly mentioned. You can get the ectodermal dysplasia and other conditions due to exogenous increase in temperature, which not respond to antibiotics. Okay, now well, you see who is the first person to answer the first question. Chirumali Ubendra is the first person to answer the question and answered within 5 seconds. We got a 29% answer, but the first person answered is Chirumali Ubendra. Congratulations.
So again, congratulations to Ubendra.
Yeah,
Okay.
first question, first round.
Let's
Now
move
we
to
go
the
for the
second.
second question. So, this is our second question. Read carefully. Medication for fever can be used only if the absolute temperature is more than 100 degree Fahrenheit. B, 101 degree Fahrenheit. C, 102 degree Fahrenheit. D, 99 degree Fahrenheit. So your time start now. Computer. Yeah. Again, I think here there may be some confusion may be there. Anyway, we'll check the answer. Computer J, what is the correct answer? 101 degree Fahrenheit. So over to Suman sir.
Okay, as a general statement, what I say is that there is no need to reduce the body temperature in all people because the fever is a protective mechanism of the body by which you can reduce the multiplication of the bacteria and other organisms. But if the child is uncomfortable with high fever, you can give an antibiotic, and the preferred temperature may be 101 degree Fahrenheit. So if you give an antibiotic if the fever is more than 101 degree Fahrenheit. One more thing is that in children with a history of a seizure, you may give antibiotics in low temperature also. Here the correct answer is B.
So rightly mentioned, fever is a friend, not a foe. So there are various studies showing that fever actually treated with the paracetamol taking more time to subside than not treated with the antibiotics. So another thing is that we have to maintain, keep in mind the relation between axillary temperature, rectal temperature, and oral temperature. So of course, axillary temperature will be 0.5 to 1 degree Fahrenheit less than oral temperature. Rectal will be 0.5 to 1 degree Fahrenheit more than the oral temperature. Now we look for the answering pattern. Computer G. So again, we got only 29%. 43% I think he answered A, B 21%, and last answer 29%. So
Okay.
now we'll see.
So the correct answer is only 21.82%.
22% only correct answer. And now we'll go for the who answered. The same person. Congrats. See again answer the question within 5 seconds. Chirumali Ubendra. Congratulations. So she got a second answer also right. Congratulations, Chirumali.
Again, hearty congratulations to Ubendra. for answering the second question correctly.
Yeah.
Okay.
We will for the third question. Computer the third question. So here we got a fever. All questions are related to fever. Pondaic fever is caused by which organism? We got a four choice. Question A, Mycoplasma. B, Legionella. C, Campylobacter. D, Chlamydia. So we'll our time start now. Yeah. So time is over. Now we'll for the which one is computer G, which is the right answer. So Legionella. So for explanation,
Okay.
I request Sumar sir to give the details.
Okay. This question is on Pontiac fever. Pontiac fever is a fever that is produced by Legionella. See, actually, the Pontiac fever is first described from a place called Pontiac near Michigan. Actually, the Legionella can produce two types of fevers. One is the Pontiac fever and other is legionellosis. Pontiac fever is a very mild disease characterized by fever and generalized body ache. There are three answers are there. As you know, Mycoplasma will produce pneumonia, say walking pneumonia. Campylobacter usually produce a diarrhea. Campylobacter diarrhea can be there. And Chlamydia trachomatis can produce chlamydia pneumonia. It is always called febrile pneumonia. Usually in the children in the age group of 3 weeks to 12 weeks, they are present with a persistent cough, just like pertussis, and fever will be absent. So it is an febrile pneumonia. So the correct answer is the organism that could produce Pontiac fever is Legionella. But Legionellosis is a severe disease, and these children can present with high fever and features of atypical pneumonia, and they respond to antibiotics like macrolides, clarithromycin, or azithromycin, or they may respond to moxifloxacin. Okay.
So the right answer is Legionella, and as rightly mentioned, it is not responding to our conventional antibiotic, just like Mycoplasma, ceftriaxone, penicillin, other penicillin group is not effective. Best drug is macrolide group. So we can just now see the answering pattern. Computer G. Very good. So I think it is a one non-controversial question. Very good question. So 81% rightly answered the right answer, and others I think only one student answered each other options. So now we will again go for the our who answered first and rightly. Yeah, Palaguja Chandrakant. I think right, and it is record 3 seconds. I think answered within 3 seconds, and it is Palaguja Chandrakant. Congratulations. Who answer?
Yeah, congratulations, Chandrakant.
Yeah.
We will move to the next question.
Yeah, we go to the next question. The first two questions answered by one person. Now it is third question. And we will go for the fourth question. Okay. A very good, interesting question. Camelback fever pattern because of biphasic fever, that is typically camel got a double hump, is seen in poliomyelitis, typhoid, malaria, dengue. So fever pattern is very important. So computer J, our time will start now. So, well, for the right answer, computer, right answer. Yeah, poliomyelitis. The poliomyelitis is get biphasic fever. So I request Kumar sir to give the
Okay,
details.
there are various patterns for fever. It is very important that in all patients you should have a temperature chart and find out the type of fever to pick up a correct diagnosis. A patient can have a continuous fever, remittent fever, intermittent fever, or a camelback fever, that is biphasic fever. In biphasic fever, the temperature reaches the normal at least 2 times a day. And the commonest condition that produces a biphasic fever is poliomyelitis. But other conditions like yellow fever, rarely dengue, malaria, and typhoid and leptospirosis can present with biphasic fever. But the classical condition will be poliomyelitis. Thank you.
So the recording, the pattern of fever is very important. In olden days, we used to record fever like the stepladder type of fever, and the fever followed by lysis, fever followed by crisis. I think nowadays it is not commonly practiced. Right? Anyway, poliomyelitis is not there in India also. Anyway, historically, I think it is very important question and answer. Now we'll see the answering pattern. Who answered maximum? Which question? Yeah. Computer J. How many of them answered right answer?
Okay, now this the main problem is they have answered dengue, but unfortunately, if you go for a Google search, in Google this written that in dengue fever also the temperature is biphasic. But if you consider the all conditions like poliomyelitis, in poliomyelitis also, classically there can be a biphasic fever. Thank you.
We look for the person who answered first. Computer Ji, who answered the first? Dr. Balsu Himabindu.
Okay.
Yeah,
congratulations, Himabindu.
Yeah, very happy to see that different persons are getting first right answer. She answered within 3 seconds. Now we'll go for the fifth question. So, next question. Score used in Kawasaki disease. Igami and Kobayashi score, Sano score, Kanda score, all of the above. So, here you can see that different scoring system, it may be related to Kawasaki disease or not. So, you have to answer the right one. So, our time start now. Okay, time is over. So we'll for the right answer. Which one is right answer? All of the above. So request Suman sir to give the explanation.
Okay, Kawasaki is the commonest collagen vascular disease that we see in children, and it is first described from Japan also. And as the names are here, all the names are from Japan. So it is very difficult to read the scoring names. Even it is very difficult to read that also. But when I read the literature, there are one more risk scoring system is there. It is called Formasa risk score, and all of the correct answer is all of the above. But there is some significance for all this scoring system. If you consider the Kobayashi scoring system helps you find out the risk for IV IgG resistance. You know, some of the cases of Kawasaki disease, they can have what is called a resistant Kawasaki. So this Kobayashi scoring system helps to find out the risk for IV IgG resistance. Then if you consider the Haranda scoring system, it helps to find out the risk for coronary vascular involvement. The commonest problem and the direct problem in Kawasaki disease is coronary involvement that occurs in the first week of life, and that can be prevented by IV IgG. So you must have an idea about all this scoring system, which helps to assess the resistance to IV IgG and also to find out the risk for coronary artery involvement in children with Kawasaki. Thank you.
As sir is rightly mentioned, it is a Kawasaki disease, one of the commonest disease nowadays, commonest cause for acute heart disease, including in India. And here, this cause is not to diagnose the Kawasaki disease, but as rightly mentioned, IVIG, resistance, some other parameters. So it is not to diagnostic criteria we know. So we'll go for the pattern of answering. How many of them answered D? Computer G. So the answering pattern. Yeah,
Okay.
very good. 50% of them
Okay.
answered the right answer, and 35% they opted for the choice number A. And happy to see that the majority answered the last question. That is all of them. Now we go for the right answer, first person. August Nair. So he had taken 3 seconds. Congratulations, August Nair.
Again, hearty congratulations to August Nair and all the best.
So we'll go for the sixth question. Next question, computer. Yeah, a very common problem. Diverse test for pinworm. Stool routine microscopy, stool culture, Scotch tape method, all of the above. I think it's a very simple question, even though nowadays are not very common. Anyway, we'll go for the answering. So, computer G. Yeah. Okay. Now we'll look for the right answer. Last, yeah, it is a Scotch tape method. I think Sukumaran sir, a lot of people are very familiar with this one. Sukumaran sir.
Yeah. See, the thing is that nowadays, and for a pediatrician, for the diagnostic tests are not very important for diagnosis of pinworm infestation. It is mainly a clinical diagnosis. A child presented with perineal itching, you make a diagnosis of pinworm infestation and start treatment. And the drug of choice may be pyrindole palmate or albendazole, given as 2 doses. But in a clinical setup, this, if you want to confirm the diagnosis, you must go for a Scotch tape method. In this method, you applied a cellophane tape around the anus before bath, and then you remove the cellophane tape and look for the ova of pinworms or pinworms in the cello tape and count the number of ova. It is present, it is taken as an evidence of pinworm infestation. So the correct answer is Scotch tape method, and stool routine may also shows these the ova. Stool culture is definitely not important. You cannot make a stool culture for diagnosis of pinworm infestation. So correct answer is C.
Yeah, usually we used to treat it with the pyrindole palmate, 2 doses. Means after 2 weeks you have to repeat the dose. Another thing is that the characteristic egg, it is a colorless here, and you got a very clear, no, not bile stained, and it is a plano convex. I think for our parasitic during our 3rd year studentship, we know different types of egg. It is a plano convex, colorless egg. You can see the worms inside this one capsule. So the right answer is Scotch tape method. Now we'll see the answering pattern. How many students opted for the answer number? Right answer, C.
Computer G.
Yeah, very happy to the around 63% answer right answer, and I think yeah, very good trend. So now we'll see who answered first and who answered the right answer. So Katigeru Mamada. So congratulations, Mamada. She answered in 2 seconds. So I think it's a record time, 2 seconds she answered it.
Okay.
Very
Happy
wonderful.
congratulations to Dr. Mamada for answering it so quickly.
Yeah.
Congrats.
Now we'll go for the 7th question. So, we got another important question. Blueberry muffin rashes are seen. I think it's comparatively easy question. You can see it here. The picture you can see here. Congenital syphilis, rubella, measles, none of the above. I think comparatively easy question. But time start now. Yeah, we are sure that almost all of them answered the same question. Anyway, computer G, what is the right answer? Yeah, rubella. Rubella. Some rubella is one condition. We'll get a blueberry muffin rashes in many conditions. But anyway, we'll look for the right answer. Right answer, computer G. Answering pattern. Computer G.
Yes, sir. They will be working 2 minutes.
Yeah. Okay.
10 seconds.
Yeah. Excellent. 74% have answered. And as we already mentioned, it is not specific to rubella alone. I request Suman sir to give more details about answer. Suman sir.
We can continue.
Suman sir.
It is internet, so you can ask for the right person if you don't have any.
So
The person-
blueberry muffin, we get many conditions: congenital leukemia, Langerhans histiocytosis, rubella, toxoplasmosis, cytomegalovirus, and hemoptysis of the newborn. So commonly, our answer is a common condition. What we are seeing is congenital rubella. So we may get in some other conditions also. So now we go for the right person who answered the back with in a short time. So Agila Reddy, Say Reddy. She again answered within 2 seconds. So congratulations, Agila Reddy. She also answered within 2 seconds. Now we'll go for the 8th question. Okay. So our next question: cat scratch disease is caused by Bartonella henselae, Epstein-Barr virus, Cardiobacterium hominis, Trophiema bifili. So out of this, which one is the right answer? Your time starts now. Okay. So time is over. Computer G, now we want to know which one is the right answer out of this 4. Which one is? Yeah, it's very clear. It is a Bartonella henselae. Cat disease.
Dr. Anand, I am here again here.
Yeah.
Some net problem was there.
Yeah.
It was cleared. As you can
Switch on your screen, sir.
Yeah.
Not visible.
Not
Yes.
visible.
Yeah. Okay.
At least,
Yeah.
as you can hear.
Yeah.
Okay. Cat-scratch disease is a disease produced by Bartonella species. And following the scratch by a cat, you develop an injury site. There can be a scar there, and there can be associated lymphadenopathy can be there. And if you do a biopsy from that lymph node, they may show a granulomatous lesion can be there in the lesion. And as you all know, Epstein-Barr virus infection produce infectious mononucleosis, and Cardiobacterium hominis usually produce endocarditis and Trophiema bifili it can produce Whipple's disease, which can manifest as persistent diarrhea and malabsorption. So the correct answer is Barnatella penicillin.
Yes, sir. So now we will see the answering pattern. Yes, almost 100%. Answered the right.
Correct answer. Okay.
Yeah, correct answer. Now the question is, the knowledge part is clear. Now the part is technical aspects. Who answered the first? That is important, sir. That is also important. So please show the first. Yeah. Take to Mamada. I think she second time she's answering. So congratulations, Mamada. He again answered within 2 seconds. So our 8 questions are over. Now we'll move to next
So,
question.
hearty congratulations to Mamata for the correct answer in very quick time. Thank you.
So now we move to next question. Question number 9. Yeah. So question is, the sulfur granules are characteristically seen in actinomycosis, blastomycosis, nocardiosis, Crohn's disease. So your time starts now. Yeah. Time is over. Now we'll see which one is the right answer out of this 4. Yeah, I think it is comparatively a simple question. Actinomycosis. So we are again expecting 100% answer for this question. Because for MD pediatric student, I think it is comparatively simple question. So we'll see the answering pattern.
Okay. Actinomycosis is a common anaerobic infection seen in children also. And the etiological agent is called Actinomycosis Israeli. And they produce sulfur granules. Actually, sulfur granules is not sulfur. It is yellow in color. So it is called a sulfur granule. Actinomycosis are Israeli. It may be seen normally in the throat and nose. So those children with immunodeficiency, etc., they can produce infections around the neck, oral cavity. They can present the cervical lymphadenopathy, abscess in the lymph node. Rarely they can present the mediastinal disease. They can have lung abscess, pneumonia, etc. And the diagnosis can be confirmed by taking a biopsy also. And the drug of choice for actinomycosis is again penicillin. We have to give IV penicillin for 4 to 6 weeks, followed by oral penicillin. A long-term treatment is required. And blastomycosis, is a fungal infection. Again, nocardiosis is an infection produced by anaerobic organisms. Crohn's disease, Crohn's disease, ulcerative colitis, they are inflammatory bowel disease. So the correct answer is A, actinomycosis.
We see the answering pattern now. Yeah, as we expected, I think 97% answered the right answer. Now we look for the who answered it first. Sridhar Shellikedi. So congratulations, Sridhar. Again, answered within 2 seconds.
Okay, hearty congratulations to Shellikeri for answering it so quickly.
Okay, now we move to 10th question. That is almost second half of the question pattern. So question is, all are causes of pneumonia in children from 1 to 5 years of age, except, again, I think a comparatively simple question. First one is pneumococcus, second Streptococcus pyogenes, third one E. coli, fourth one mycoplasma. So, for except was for pneumonia, yeah, time start. Okay, computer G. So which one is the right answer? Okay, now we have Suman sir, national
Okay.
expert in pneumonia at a national level. So over
Yes,
to
yeah.
Suman sir.
Thank you, Dr. Anand. As you all know, pneumonia is the commonest cause of commonest infection disease that produces morbidity and mortality in children. It is reported that more than 19% of under 5 deaths are due to pneumonia. These four organisms can produce pneumonia, but the etiology of pneumonia varies from age-wise also. In the first 2 months, the commonest cause of pneumonia is the gram-negative organism, like E. coli, then Klebsiella, and rarely Streptococci. But in the age group of 1 to 5 years or 2 months to 5 years, the commonest organism may be 3, maybe H. influenza, pneumococci, and staphylococci. These are the three common organisms. Then above 5 years, the commonest organism may be pneumococci and also Mycoplasma pneumonia. Mycoplasma pneumonia accounts for more than 25% of pneumonia in children above 5 years. So E. coli will not produce pneumonia in children 1 to 5 years. So the correct answer here should be C. Gram-negative organism produce pneumonia in the newborn period, first 2 months. And also viruses are also the commonest cause for pneumonia.
Here
Okay.
again, we are expecting 100% answer from all the MD or pediatric students. So computer G, you show the answering pattern. Yeah, 70%. Anyway, 20% answered question D, but usually there will be any confusion. So now we look for the who answered first. Computer. Agash Naya, I think he is answering second time. Agash Naya, go to the answer within 3 seconds. Congratulations, Agash Naya.
Yes, again, congratulations to Agash Nair a second time.
And there should be some sound when you are showing this one. There will be some sound, background sound, because they are seriously. Okay, now we'll go for the 11th question. Okay, another very disease confined to pediatric age. Exanthem subitum is more often caused by human herpes virus 5, human herpes virus 6, human herpes virus 7, human herpes virus 8. We have a name for each one. Anyway, we have a time start now. Yeah, I think now we'll go for the right answer. Computer just show the right answer. Yes,
Okay.
it is HHV 6B. Now we'll request Kumar sir to give the details.
See, as you know, Exanthem subitum, there are other names for Exanthem subitum. It is otherwise called Roseola infantum or sixth disease. No, there is a numbering for all infectious disease, all the viral exanthem. You say the first exanthem disease is measles, second is scarlet fever, third is rubella, and fourth one is Duke syndrome, and fifth is erythema infectiosum, and the sixth one is the same as exanthem subitum, and it is produced by human herpes virus 6. These children will present with a high fever, lasting for 3 to 5 days, and once the fever subsides, the rash appears. This is the most important thing. The fever subsides first, followed by rash, then you can make a diagnosis of exanthem subitum. So the correct answer is human herpes virus 6. B.
Yeah.
B is the correct answer.
So human HHV 5 is none other than our human HHV, it is cytomegalovirus, and HHV 4 is Epstein-Barr virus. So different names are there. Now we'll go for the answering pattern. Yeah, very good. Around 68% answered the right answer. So I think a majority of them answered rightly. So now we'll go for the who answered it first. Computer. So Aguilar Reddy Harry, I think she's answering the second time. So congratulations, Aguilar Reddy. She answered within 2 seconds.
Again, congratulations to Aguilar Reddy and all the best.
Okay. Now we'll for the 12th question. Computer ji, next question. Yes, almost another question. Erythema gangrenosus is caused by first question number 1, Pseudomonas. Second one, Staphylococcus. Choice C, Enterococci. And choice D, aerobic gram-negative bacilli. Your time starts now. And yes, I think we'll go for the right answer. Computer ji, block the right answer. Pseudomonas. So very characteristic rash of erythema gangrenosus by Pseudomonas. Over to Suman sir.
Okay, erythema gangrenosus is one of the manifestation of a severe infection by Pseudomonas. Now we are not seeing much of the cases. In those children with an immunodeficiency, may say erythema gangrenosum. This other is called ecthyma. Ecthyma. It is called ecthyma, and it is seen as a greenish patch, mainly seen over the buttocks and the IV sites. And the etiology is Pseudomonas. So the correct answer is A. No, Staphylococcus aureus will produce Staphylococcus pneumonia, pneumothorax empyema. Enterococci usually produce endocarditis and sepsis and other enterobic organisms. And so the correct answer is Pseudomonas.
Here again, we are expecting almost 100%, about 90% answer. Computer ji, show me the answering pattern.
Oh,
So I don't know why this much a confusion here.
67%.
68% are rightly answered, and around 19% of from other answer. So anyway, now we'll see who answered the question first. Aguilar Reddy again. I think she answered in 2 seconds. I think it is her fourth answer. So congratulations, Dr. Aguilar Reddy. Suman sir.
Okay, congratulations, sir. Aguilar Reddy, once again. Next question.
Yeah, next question. So it's a neurotropic virus question. Herpes simplex encephalitis involved primarily which lobe of the brain? A. Occipital, B. Frontal, C. Parietal, and D. Temporal. So your time starts now. Yeah, comparatively, I think it's a simple question. Anyway, we'll go for the right answer. Computer ji, mark the right answer.
Okay. It's an as Dr. Ananda said, it's a very simple question. And you can see that those children presented with encephalitis and encephalopathy, those children presented with fever, headache, altered sensory and seizure, you make a diagnosis of encephalitis. But those children presenting with encephalitis, you must try to make a clinical diagnosis to the etiology of the organism. As shown here, if there's mainly a temporal lobe involvement, the child is presenting with a complex partial seizure or sensorium, then you may suspect herpes simplex encephalitis. If the mainly cerebellar involvement is there, maybe due to chickenpox virus. If there is involvement of the basal ganglia, basal ganglia involvement is seen in some type of encephalitis, and in Nipah virus infection, there may be involvement of the brainstem involvement can be there. So from this clinical involvement, the site of involvement of the virus, we can have a clue without a viral culture and other investigations. And also it is very, very important that you must diagnose herpes virus infection because it is one of the virus infection that can be treated with an antiviral drug, as I call it. Now, expert on this subject is Dr. Ananda Keshavan. He's a pediatric neurologist. I can have more comments.
So as we know, culture and serological diagnosis will take a long time. So mRNA result will get a short span. So there are different neurotropic virus already mentioned by Dr. Subhanis sir. So temporal means the infection with herpes simplex, we got a very good drug with a very good rate. So that is why diagnosis of herpes simplex is very, very important. You can treat it with the effective drug like acyclovir. So diagnosis is very, very important. The student should know which part of the brain involved by different types of virus. I'm not going to detail again. So now we'll see the answering part. Computer G. So very happy to see that our students know means, the temporal lobe is commonly affected with the herpes virus. So around 90% answered the right answer. So now we'll see who answered it first. So Sheikh Mayim, I think the Sheikh answering first time.
Within 2 seconds. Within 2 seconds.
Yeah, 2 seconds.
So
Congratulations.
congratulations, Sheikh Mahim. Okay.
Now we'll go for the 14th question. 14th. So, another question from regarding viral infection. Duration of nevirapine prophylaxis for HIV if mother has received ART less than 24 weeks during antenatal period. Duration of nevirapine prophylaxis. So, first answer is 4 weeks. Second one 8 weeks. Answer 3 12 weeks. Last answer 24 weeks. Computer. Now start your time. Yes. Now we'll see the right answer. Computer G. 12 weeks. So over to Sumar sir.
Okay. In mothers who are HIV positive, there can be a vertical transmission of HIV to the child, and mother to child HIV transmission can be prevented by giving nevirapine, and the duration of treatment should be 12 weeks. The correct answer is 12 weeks. It's very simple.
Yeah. Now we will see the answering pattern. So 60% answered the right answer, that is 12 weeks, and rest answered second choice is 16% answered, and A and B by 11% down. So we now will see who answered it first. Chandragant, Hulugja Chandragant again, she answered within 3 seconds. So congratulations, Chandragant.
Yes, hearty congratulations to Chandragant once again.
Yeah,
Next
I think
question.
she's answering second
Next
time.
question.
So we'll look for the 15th question. Yeah, 3/4 is over. 25% is remaining. I think Pure Foundation put a simple question for our students. Identify the infection based on image. First one scarlet fever. Second HFMD, maybe hand foot mouth disease. Third one is measles. And fourth one is herpes angina. So your time starts now. Okay, now we look for the right answer. It is very obvious from the picture. So, computer G, right answer. Yeah, hand foot mouth disease, very contagious disease. Over to Sumar sir.
Okay, hand foot mouth disease is a very common infectious disease that we see now in our children, and it is mainly a clinical diagnosis. These children will present with high fever, with the drooling of saliva. When you examine the throat, there will be herpangina will be there in the throat. Multiple ulcers will be seen in the throat. And vesicles are mainly confined to palms, soles, elbow, knee, ankle, sole, and feet. And now I think the name has to be changed to, instead of hand, foot, mouth disease, it should be hand, foot, mouth, buttocks disease. Conditions are mainly confined to buttocks also. And in Malayalam, we call it as tomato fever or takkali pani. But here the confusion is that we have seen only hand and feet. Another condition which gets a rash like is ricketts disease. Ricketts disease can also present with rashes in the hand and feet. In children with scarlet fever, they will present with very beefy red tongue and skin. You can see that skin is very tough, and there can be in sandal and sandal-like skin will be there. And also in children with measles, the classic accompanying spots will be there with a rash, and rash which appears at the peak of fever. And herpangina is very commonly seen with multiple throat ulcers. So the condition diagnosed in this child will be hand, foot, mouth disease. Even though the hand, foot, mouth disease is a very simple disease, these children can early develop complications. They can present with the neurological complications like encephalopathy, ADEM, and severe pneumonia and myocarditis also. Thank you.
Usually it will be very benign disease, especially when it is caused by Coxsackie virus A16. But when it is a enterovirus A771, you may get some complication, as Kumar rightly mentioned. You may loss of fingernail, toenail, encephalitis and meningitis. Now we will look for the answering pattern. So I think a majority, a very good response, 98% answered it rightly. Now the question is, who answered it first? So now we'll Computer Ji, who answered? Again, Ketigoro Mamada, I think she's answering it a third time. So congratulations, Mamada.
Congratulations, Mamada. Once again, very quick in answering. Thank you.
Yeah. Now we'll move on to 16th question. Computer Ji, our next question. Okay, I think another simple question. Equal gauge for the skin lesion given below. You can see some skin lesion on the face. It's very clear. Dermatophytes, Malassezia furfur, Candida, and the answer D is Microsporidium species. So your time starts now. ABC. Yes, it's a very, very common condition. So we'll ask for computer the right answer. Yes, as we expected, it is a easier furfur. Over to Suman, sir.
Okay, now all the clinical problems, especially pediatric dermatological problem, before starting any cream or ointment, you must have a clinical diagnosis. Clinical diagnosis is very, very important. In this child, there are two possibilities by looking at the lesion. First possibility is a tinea versicolor, and second may be a pityriasis alba. This seems to be a tinea versicolor, which is produced by Malassezia, a furfur and a scaly lesion, hyperpigmental lesions with correct edge. You can diagnose tinea versicolor produced by Malassezia furfur. The drug of choice may be miconazole gel, and the antifungal ointment should be applied for a minimum of 1 month for the treatment of Malassezia furfur. Thank you.
It is one of the DD for the hyperpigmentation of the face. So students can expect a question like a hyperpigmentation of the face. Now we'll see for the answering pattern. Again, a simple question. Yeah. So around 84% answered rightly. Simple. A simple condition, common condition, treatable condition. But again, may confuse with the other hyperpigmentation. So now we'll see who answered the first. So it is a Sridhar Shellikeri. Thomas was mentioning about the scoring system for Kawasaki is very difficult. Yes, some name also difficult for me. Anyway, Sridhar, congratulations for Sridhar. He answered within 2 seconds.
I think Anand, you say the first name. First name is Sridhar. Sridhar is a very common name in our place also. So
Yeah.
hearty congratulations to Sridhar also.
We'll go for
Okay.
70th question. Only 3 remaining. Yeah. Tell this person with the history of fever for 4 days along with the seizure. Rash developed on trunk a day after the rash and the fever subsided. What is the most probable diagnosis? Again, our time starts now. Question number A, measles, B, rubella, C, herpes, and D, torsion. Okay, a simple answer for the pediatrician. Anyway, computer G, select the right answer. Yeah, Roseola infantile. Another
Okay.
question.
Anand,
But
already we
no-
have discussed this same problem.
Yeah.
Roseola infantum is otherwise called exanthum subitum, or it is otherwise called sixth disease. And in all viral exanthemas and fevers, it is very important to find out the relation between the onset of rash and fever. If you take measles, they will present a high fever for 5 days with congenital congestion, rhinitis, congenital congestion, and severe cough. Cough should be there for diagnosis of measles, and complex spots will be there. But in measles, the rash appears mainly in the forehead, upper part and lower part, and rash appears at the peak of fever. Rash appears at the peak of fever. But in this child, the rash develops once the fever has subsided. So high fever, the fever subsides first, when the child develops rash, then the diagnosis will be roseola infantum or exanthum subitum. Rubella is a very mild disease. They will have a low-grade fever for 2 to 3 days, then a mild rash with an occipital lymphadenopathy. This rubella. Herpes, you can have characteristic vesicles confined to one part of the body. So here also the answer is D, roseola infantum.
So now we have effective vaccine for measles, rubella, mumps, and chickenpox. So now there is chance for seeing more and more cases of condition like roseola infantum because there is no effective vaccine. But luckily they are simple infection. Now we'll see the answering part. Computer जी भाई उल्टा हुआ this more answer for the there's need for any confusion here. I think by looking the picture they may answer because picture is a distant view, but by history I think
Also, see, Anand, measles is, they can't make a diagnosis of measles. All the PG should know what is measles. They will have some high fever, congenital congestion, nasal congestion, persistent cough, and rash on the third or fourth day. Rash appears in the face, and rash appears in the peak of fever, and the rash disappears within 2 to 3 days, and complex spot will be there.
Yeah.
This is very typical.
Yeah.
This one measles.
Our students should be very familiar with the measles. So I think the right answer, only 25% answered the right answer. Now we'll see who answered it first. Yeah, Sadabadi Kirti. So Sadabadi Kirti answered it within 2 seconds. Congratulations, I think she answered it the first time. Sadabadi, congratulations. Okay, now we'll have 3 questions remaining. 18th question. We'll move to 18th question. So, what is the positive organism for the below infection? You can see some beautiful picture. First one is a parvovirus B90. Second one HHV6. Third one is a CME cytomegalovirus. And last one is varicella zoster. Your time starts now. Yeah, again, a simple question for a pediatrician with a beautiful picture. Computer ji, give the right answer. Parvovirus B19 or to Suman sir.
Okay, this what is the diagnosis? It is very important that, as I said before making a clinical diagnosis, you must make a diagnosis before trying to find out the etiological organism. Definitely, it is a parvovirus B19 infection, and the diagnosis here is fifth disease. Fifth disease, or you can say this child has got a slab cheek appearance. Fifth disease or slab cheek appearance. It's very important to pick up this disease because if the mother develops a parvovirus infection, it can produce hydrops vitalis in the baby. And if a child develops parvovirus infection, it can produce bone marrow aplasia. Aplastic anemia is one of the complications of this parvovirus 19 infection. So it is erythema infectiosum or fifth disease, and the causative organism is parvovirus.
It will produce aplastic anemia also, and also a very important virus nowadays. And now we'll see the answering pattern. Yeah,
Right.
comparatively, very many of them are
Agriculture.
answered rightly. 78% answered question number parvovirus, question number A, 20% for B. Anyway, congratulations. Now we see who answered it first. Yeah, from the Nandini Dupati, Nandini answered the first. So she answered. Time is not shown. Anyway, congratulations, Nandini.
Congratulations to Nandini for the correct answer. Then we'll move to the next case.
Yeah, 90 the question start now. Why is a switch off on? Time not come? Any problem? Yeah. Yeah, our 10-year-old child with history of fever and rashes over body, including palms and sores, with history of travel to village. What is the diagnosis and treatment? Rickettsial fever, doxycycline, hand-foot-mouth disease, supportive treatment, scarlet fever, amoxicillin, urticaria, antihistamine. So your time starts now. So I think we'll look for the right answer because all pediatricians should know the right answer because early treatment and the drug of choice is very, very important. So computer G, the right answer. Rickettsial fever, doxycycline is a drug of choice. Over to Sumar, sir.
Rickettsial, you must, in all children, you must take a very detailed history. Here he says an older child, 10-year-old child with history of fever and rash in palms and sores. Last time also I told you, in HFMD also, there will be rash on the palms and sores. Similarly, rickettsial fever will have a rash on the palms and sores. They are going to a village area and they may have some injury also. And the correct diagnosis in this child is a rickettsial fever, and the picture shows a characteristic scar. But scar is usually seen in the hidden part of the body, just below the breast, in the perineum, thighs, etc. But in the you can see in the thigh also, you can see the scar. The rash may be seen in the hands and palms. And if you do an estimation of the serum sodium level, it may be also be low. You can confirm the diagnosis serologically. The drug of choice is doxycycline, as Dr. Anandas correctly said. One of the complications of rickettsial fever is temporary shock and encephalopathy. So it is very important to pick up this disease because it's one of the treatable conditions. Scarlet fever also, I said before, these children will present with red beefy tongue. Red beefy tongue with a sandpaper-like skin. The skin will be very tough, sandpaper-like skin. Then you can make a diagnosis of scarlet fever. HFMD we have already seen. Urticaria is a clinical diagnosis. A child present with multiple raised lesions with a itching can make a diagnosis of urticaria, and the treatment of choice will be antihistamine. So the correct answer is A.
Yeah, the majority, because the most important that you have to remove the cloth because it will be there hidden area, axillaria, gluteal fold, and palm, sole of the foot. So very important, very important of physical exam is very important. Anyway, very happy to say that 89% answered it rightly, and drug of choice is doxycycline. So now we'll see the who answered it rightly first. So Navina, I think Navina is answering right question, right answer first time. So congratulations, Navina.
Hearty congratulations, Dr. Navina.
Now we go for the last question of today's last question. Computer ji, last question. Humanity has but three great enemies: fever, famine, and war. Of this, by far the greatest, by far the most terrible is fever. This famous quote by whom? Because his question is completely on fever. So everybody should know, other than medicine, they should know our great scientists. Like question A is Hippocrates. Answer B is Alexander Fleming. Answer C is William Moser. Answer D is Paul Ehrlich. So very important. So we have to should know answer other than medicine also. Yeah, what time start? Okay, I think again not very difficult, but anyway we'll for the right answer. Yeah, William Moseley, the father of modern medicine. I think he's a great physician. He started the original ward rounds, the original modern teaching style of modern medicine. I'll request Sukma sir give more details about William Moseley.
The thing is that you can see four great men here: Hippocrates, William Osler, Alexander Fleming, and Paul Ehrlich. As postgraduate students of pediatrics and medicine, you should have a general idea about the history of medicine. Is very important. You must read the history of medicine sometimes and know the great people. See, William Osler, he is supposed to be the father of modern medicine. He's a Canadian physician, and he was one of the four founding fathers of Johns Hopkins Hospital. And as Dr. Anandya said, he has started the bedside clinics for medical students. That is the most important work done by William Osler, bedside clinics. Hippocrates, as you all know, the Hippocrates oath that is followed by all modern medicine doctors. Alexander Fleming is a Scottish physician, microbiologist, and his most important invention is penicillin, the antibiotic. The penicillin antibiotic was first invented by Alexander Fleming, and he got Nobel Prize for his discovery. And regarding Paul Ehrlich was a Nobel Prize winner. He's a German physician and a scientist who worked in the field of hematology, immunology, and nutrition also. And he found out the first treatment for syphilis also. He's a fantastic scientist and investigator of modern medicine. So the correct answer here is, this is the quoting from by William Osler.
Students should be familiar with the Osler's line, Osler's notes, Osler-Weber-Rendo disease, Osler-Weber disease, Osler-Liebman-Sack endocarditis. Actually, it is Liebman-Sack, but it is Osler-Liebman-Sack disease. So there should be, there are so many other inventions by the Dr. William Osler, Sir William Osler. So now we'll see the answering pattern. So you can see that when it comes to history, we are confused. We should respect our teachers. We should respect our great scientists like that, and we should also concentrate on other something. And whenever we are presenting a topic, we have to start from the history. So here importance. Thank you, Fever Foundation, for including such a beautiful question regarding the last 20th question, means regarding the history. Wonderful question. Anyway, our students are confused. I think it is the only one question where the distribution is almost equal. So our request is so concentrate on history also. Now we'll see who answered first.
See, one more thing is, Anand,
Yeah.
our students should have some general knowledge. Now
Yeah.
people have no general knowledge at all.
Yeah,
They should answer general knowledge question.
Yeah.
This should be there.
Whenever there's a topic on fever, we should know all the quotes by fever. I think very commonly every speaker will quote this one. There are so many other important quotes by William Moss. If you are not going to the ward, there's no meaning. Go to something like there are so many wonderful quotes by William Mosley. Yes, sir.
Okay.
Okay.
Thank you.
We'll go for the first person who answered. Sridhar. Again, Sridhar is answering another. Sridhar.
Second.
Yeah.
Second.
Yeah, I think it's second or third answer. Right answer. 4 seconds. So today's program, I think 20 questions over. Now we'll see.
Yeah.
Beautiful question. I think you can stop sharing the screen now. And both knowledge and technique, how to answer quickly, everything will count here. So even though 130 questions were very simple, but only one person will get the mark. So now we'll see who got the maximum number of answered, and also second person also, because it's a team for the final round. So first person and second person.
Yeah.
For
Meanwhile,
further
sir.
proceedings,
Yeah.
Manjula madam, over to
Yes,
Manjula
sir.
madam.
Thank you, sir. Sir, meanwhile, they're doing it. I just want to make one announcement by the time they can Abhira or Dr. Krishna share this. So, dear participant, it was wonderful. All of you played really well. We'll see who has got fastest correct answer. We just see that. And nevertheless, participation is a big thing, and that itself is a winning. Getting first and second prize is just a nomenclature, I can say, participation. So all of you are winner. Let's see who stands. Before that, I just want to make one more scientific activity which we are going to do is we're going to start the poster presentation competition like last year. So we are going to share the link from tonight to tomorrow, where you can register for poster presentation competition. So this FEFCON 2022 scientific committee will invite all doctors, postgraduates, and practitioner clinicians for the opportunity to exchange and share their experience on various aspects of fever management. And the conference, this is in preparation to our upcoming conference of FEFCON 2022, which will be on 5th and 6th. So the point to be noted is this will be electronic form only. There are 2 pictures over here. You should use the template used here. That means it is PPT, 16:9 ratio PPT. So one case presentation will be 1 slide. So you should use this, and this will be available to you download in your registration link. So case presentation and should be 1 poster, and it should be uploaded. Next slide.
It is both the poster and
case presentation. So they can select either if they are selecting research activity, or it can be case also. Anything they can upload. Yeah. And then just to some of the guidelines for this virtual poster presentation, we are only accepting electronic posters and e-posters, and in the PowerPoint, and printed poster or photograph of the printed poster will not be accepted. And topic should be related to fever only. It can be case based, or it can be research based. And category of participation, you can choose from the drop-down button while you are selecting when you are uploading. Is it a case study or original research paper? And our scientific committee is going to screen, and the top 10 will be called for presentation. Only the first author will be allowed to present the paper. And poster will be considered only it is submitted in the as per the template. And the word limit should be 15 for the title. And then along the with the 1 slide PPT, you are expected or requested to submit your article which is in the word format, which is maximum of 500 words, and the article should be in the form of how in the Indian Pediatric, which is the official journal of IAP. So acceptance of the poster presentation will be entirely at the discretion of our scientific committee, and their decision is final and it is binding. For any further queries regarding the poster presentation or research material presentation, please you can mail to feverfoundation@gmail.com. So all participants will get participation certificate, and winner will be given the attractive prizes. So all the posters which have been selected will be available for viewers, for all the delegates of the conference, on the dedicated poster presentation hall on the virtual platform. So all these details will be sent to you, your registered email IDs and the link also, and our team, Fever Foundation team, will be meeting your HOD also to inform this so that you will be allowed to upload or allowed to participate in this case presentation competition. So that's from it. Yes, sir.
Need some modification, madam, that I will contact you personally. So I
Yes,
need some
sir.
modification here and there.
Okay.
Anyway, congratulations to and thanks to Fever Foundation for doing a wonderful academic activities, not only for physician, pediatrician, or other group of doctors, but also PG students. So they actively considering our students also and encouraging either by quiz or research paper mode. So they are trying their best to improve the research activities, academic activities. So I would like to thank Dr. Manjula and her team, your foundation team, for the wonderful academic activities.
See, madam,
And thank you on
Yes.
behalf of
conclude,
Sigmas also. We
Yes,
thank
sir.
you.
before we conclude, I
Can
should
you, yeah, stop
congratulate-
that. Yeah. So can we find out who all are, is there any winners or the tie or anything? Can you tell us how the results look like? Oh, sir, it's a tie.
Oh,
Agila Reddy, Sai Reddy, Mamata, and Sridhar.
So there are three people who have got the equal number. Dr. Akila Reddy, Dr. Kategaru Mamata, Dr. Sridhar Shelly Kerry, all three. Dr. Akila from Kakatiya Medical College, Warangal. Dr. Mamata is from Kurnool Medical College. Dr. Sridhar from the Karnataka Institute of Medical Sciences, Hubli. So now, since it is a try, as per our rule, these three people, Dr. Akila, Dr. Mamata, and Dr. Sridhar will only play. Rest of you, please don't vote. Three of you will be given three more questions, and then you please answer this, and whoever comes right answer correctly faster. So we are two people will be picked up from three of you and you will be representing the South Zone in the national level competition. So or to quiz master for the tiebreaker round.
Okay, now we go for
Madam, please
tiebreaker.
start.
Yeah.
Hope that there won't be any tie in tiebreaker round.
Yeah. So
Krishna,
yeah. Can we have the first question for the tiebreaker round? So please, again, only three people will play. Others need not vote. You can just be listen to the
Yeah.
question only.
others need not answer.
Yeah.
First, we'll ask three questions.
Yeah, Dr. Mamta, Dr. Akila, and Dr. Sridhar will only play, and then two of the winner fastest right answer will be picked up as the first and two winners. Let's see how it goes. All the best to three of you.
Anyway, all three are winners, madam.
Yeah,
Okay.
yeah. True, sir.
So now we'll go for the first question tiebreaker round. 8-month-old baby had fever for the past 5 days, but no other symptoms. Macular rash appeared on the second day of starting acetaminophen, and fever subsided. The diagnosis: Roseola infantum, scarlet fever, classic coptic spot measles. Last one is varicella. Your time starts now. Answer is quickly. Answer is simple. Yes, I think comparatively simple. and we'll go for the right answer. Yes, I think already described. Also,
Yeah.
infantile. Over to Dr. Kumar sir.
I think we have already discussed
described it,
all
yeah.
these problems.
I think
I think,
this should be
the
more
speed
tough
is
question.
more
You're not
important.
expected a tiebreaker. Should be a more
The
tough
speed
question.
is more important. Yeah.
Yeah. Timing. We see the answering pattern. Who answered answering pattern? I think that all three answered the same question.
Yeah, only three of them should be are expected to answer. So let us see how it goes when
Just a
they
matter
show
of
us.
time.
Yeah. So
Yeah.
relatively simple. Let's see how it's going to look like. The pattern.
But here, two of them can click simultaneously. If both of them click at the same time, then it will come. How will you interpret this one?
Yeah, a system will take, sir. System will take that because it's all computer software only.
Yeah.
It will.
Ambitriji, now answer the question.
See,
Then showing answer.
no, you can tell the thing, but yeah, they can show the pattern now first. Can you show how percentage wise how it is? Then let us see. See
answer showing may not be good. So we can see the pattern. Yeah. Answer exact person need not be there.
Yeah, need not be there. What we want, I think that what is the first pattern? How out of this? What they're telling is request others please not to participate. Then it becomes little difficult for IT team. They need to segregate and do it. Only Dr. Akila, Dr. Mamta, and Dr. Sridhar only has to answer these three. So what happens are they have to separate out and then give the result. That may take little time. So request only three of them to play on this. Others can watch and listen and watch. So if IT team is ready, you can see what is the percentage of people with answers. And let's see anyone has answered it rightly or all answered rightly or how it is. Let's see. If you are ready, can you just display? So according to you, Dr. Sukumaran sir, it's a relatively easy question because you have been discussing this.
It's very easy. I think all of them will answer. Because we had a lot of discussion on what's
What about your guess, sir, Anand sir?
Expected a tiebreaker. Otherwise, we made some difficult questions. Anyway, they are showing the pattern. Otherwise, we'll go for next question.
No. They will be showing the pattern now.
Yeah.
They'll show the pattern.
Because already described also, discussed also. That is why.
In detail.
Okay.
And also other condition, not there's no DD. It's almost totally different scenario.
Sir, according to our IT team, this question, three of them did not attempt. If I'm right, IT team can. Yeah, have they attempted? So I think three of them did not attempt this. So the tiebreaker continues. Is that the one what IT team is telling us? Yeah, no, I think someone has answered. Yeah.
Someone has answered.
Oh, they attempted, but they answered some other questions.
Yeah.
Wrong, but wrong.
So what they are telling us that no one answered it right.
Yeah, that is a delay in answering. So all three.
So that means all three got the wrong one. So we'll go to the next question then. In that case, yeah.
Okay, we'll go for the second question. So we'll get some confusion here if they are not answered. So indication for full sepsis workup in infant with the fever. I think it is a very good question. Any ill appearing infant less than 28 days. 20 to 60 days infant with the auxiliary temperature of more than 38.6 degrees centigrade. Both A and B. None of the above. So your time starts now. Yes. So comparatively very good question. So computer
Correct
ji,
answer.
now we want
Correct
to see
answer.
the right answer.
Okay.
Yeah, over to
Okay.
Suman sir.
The correct answer is A. Any ill-appearing infant less than 28 days. C. In children less than 28 days, they will have a very severe infection. So any baby less than 28 days who are very sick, very ill-appearing with fever, actually they should be admitted in the hospital, observed in the hospital, and they should have a sepsis workup, including total count, differential count, lateral count, peripheral smear, CRP or calcitonin, and 3 cultures: blood culture, urine culture, and CSF culture. So the correct answer is A.
Computer ji, now please show the answering pattern. I think this time there won't be any confusion.
Yeah, I think we should get someone who is.
Otherwise, we have to do again tiebreaker round.
Hmm. Yeah. So let us see what happens to the second question in this tiebreaker round. So let's see, Dr. Mamta, Dr. Akila, and Dr. Sridhar who got it right out of the 3. So if our IT team is ready, then sir, what do you say? Relatively not so easy, but it's
Just not
so
too
you
easy,
think
not too easy.
This
Yeah.
was yeah.
There'll
No,
be
what
an
about the previous 3 rounds, 3 zonal rounds? Is there any tiebreaker there also?
yeah, every we had tiebreakers, sir.
Acha.
All zones.
Huh.
All zones tiebreaker was there.
Huh.
So answering pattern.
Okay. So that means we have
Yeah, one person answered right answer, and 2 others maybe answered other answer. Anyway,
Yeah.
We are not looking for who answered it. Anyway, now we'll go for the third tiebreaker question. I'm not asking for the person who answered it. So we'll go for the third question in tiebreaker.
Yeah.
Third question.
Computer ji.
Enterovirus serotype causing hand, foot, mouth disease and herpesingina. Echovirus, Enterovirus 71, Coxsackie virus A, Coxsackie virus B. Our time starts now. So, computer G, right answer. Again, we mentioned it partly. So, right answer.
So this
enterovirus-
also we have discussed and discussed. This answer was discussed, but still
Yeah.
we'll see. The correct answer is enterovirus 70. It can produce severe hand, foot, mouth disease with complications.
So, now we'll see the answering pattern.
Sir, what do you think of the difficult level of this question, sir?
This is not difficult. This
So
is
they
easy.
should get it. They should get it now.
All 3 will
Some
have.
of them hand, foot may come Coxsackie virus. That is a problem. So, they will answer Coxsackie also.
Okay, so they need to give the most
but,
appropriate answer. Yeah.
But we have specifically said enterovirus.
Yeah.
Yeah.
So they should
That's
get it right now. And then hope we get after this, we get the first and 2 after
Yeah.
this round of winners, first and second winner. Let's see. If our IT team is ready, please display the percentage of the people who have answered it. And then
That's what I also there because
yeah. Sir,
okay, their confusion. Again, how 4 answer will come, madam?
Sir, so now what is happening is that's what our IT team is telling. Others are also participating.
Yeah.
Yeah, others are also. That's what I kept on repeating now to attempt. Yeah.
So now we'll get the right person from out of this one.
Yeah.
Two
So
person?
now, yeah. See what now happens is that we need to see who answered 2 questions now.
Yeah, yeah,
And then out of 3, who got the maximum. Anyway, first answer nobody got. In out of 2, we need to check.
yeah,
Then depending on who gets the numbers, then we need to see whether the next tie round is required or not, depending on the answer. So
Yeah.
if our IT team is ready, if you can show us in these 2 questions, question number 22 and 23, who answered it correctly, and then who was correctly and fastest. Oh, Mamata.
Means 22nd question only.
What about 21st question?
He or she 2 questions.
Yeah, can you show us the winner for 21st question and 23rd question, not 21st, 23rd question. So 21st, no one. 22nd, can we show the result of 23rd question? Oh, Mamta again. Congratulations, Mamta.
Okay.
So we got the first winner.
Mm.
So
Sir,
for
now
second-
it appears
second
that
winner we
again a
need to go
tie.
for
Yeah,
the
we need
tie
to go for the knockout round. I think the judges, you can decide. So only this question, Dr. Akila and Dr. Sridhar has to, because we have a number 1 position at Dr. Mamta. So congratulations, Mamta. So we have Dr. Akila and Dr. Sridhar at the 2nd position, having the same number of marks. So we need to go for the, we require 1 person out of these to represent. So I request the judges to go for the second, as we have told, it will be a knockout. You will be asking 1 question. Whoever gets answered it right fastest will be the second winner.
Okay.
So you can repeat and then do that, sir, if that.
Anand?
Okay. So this is only for Dr. Akila Reddy and Dr. Sridhar. This is for the 2nd position. Our judges are going to ask 1 question, and this is a knockout round kind of things. Whoever answers it first and correctly will be the winner. So they will be coming to Bangalore along with Dr. Mamta to represent the South Zone and take the competition in the national level quiz program. So over to you, sir.
Okay, Anand. Computer ji, show the question.
So Dr. Mamta, please don't answer. Only Dr. Akila and
Yeah,
Dr.
others don't
Sridhar has
answer
to
it.
answer. Yeah.
Yeah, vacuum pneumonia, etiological agent, Streptococcus, Mycoplasma, Staphylococcus aureus, all of the above. Yeah, I'm start now. I think we can. Yeah, they have already answered now.
Yeah, it was,
A simple
answered
question,
before,
and they have to answer quickly.
but we have discussed it earlier.
Yeah. So right answer, computer ji, already discussed. That is why we are going fastly. Yeah,
Is there
Okay,
one
plus-
thing I want to say here?
yeah,
This is walking pneumonia. We have walking pneumonia encyclopedia in the form of Dr. Sukumaran here. So we have both here, right? Pneumonia specialist and this. Right.
Okay.
So we hope, sir. What do you say? The difficult level. What do you say?
yeah. It, both of them will answer it, but who answers first? Running pneumonia. Who will run for the best?
Walking pneumonia. Who will run? Very nicely said.
Okay. We'll see.
Let's see.
The speed.
Yeah. Hope. Who
Our computer
Akila or
won't show any
Sridhar who got
confusion.
it? Yeah. Is it Dr. Akila or Dr. Sridhar who got it right and who got it first? Sir, this is the pattern.
Yeah, both of them answered. So who answered first?
Akila, ready. Yeah.
Okay.
Aguilar.
Sir, you can announce. So, congratulations, Akila, to be the second place winner. I think our computer, can I ask all of you to put first and second winner in one by then
Yeah.
another 2 minutes so that
So,
single
first person
slide
is
we
Mamata.
have both.
Second, Agila. And Sridhar also done a very
Wonderful job.
wonderful
You
job.
just missed it. Yeah, a
Yeah.
few seconds.
Yeah. It is always the
Nevertheless,
competition only like that, madam.
yeah. Little
Madam, you
luck.
are planning to send a certificate to all of them?
Yes,
Attendance
I want to.
certificate?
Yes, I want to tell all of you are going to get a participation certificate, and two of you, Dr. Akila and Dr. Mamata, would be representing as a team. We will share each other's contact detail. Our team will meet you and share, and then you will be playing as a team. Now you are individual. You will be playing as a team, and you are going to represent the entire South Zone, and then compete for the national level. And you will be called to Bangalore. Our Fever Foundation team will make all the arrangements. So you will come to Bangalore on 5th and 6th. You can attend the conference also and play the the quiz competition. There will be other team from North and then East and South. All of them have already ready because we had the competition. We have completed. So 4 teams are ready. So they will be competing in the national level competition. So wishing you all the best. Yes, sir.
Yeah, request, madam, rather than giving an attendance certificate, give Sridhar a third prize certificate. Don't give an attendance certificate. Another thing is that request both the first and second winner. You make a team yourself and while reading, preparing, and share your thoughts and everything. And just like a team from a single medical college, you act like you are representing India's South Zone. So you should have very good mutual understanding. And just like from the same college, you are coming from same parts of the country. So you have better understanding. I think both of you, I think nearby
Same
only
state.
Varangal.
Yeah. Varangal and
Varangal
And
and
madam, you can announce the state also.
yeah. Please, can you
college?
announce the
Medical
winners?
college.
If our IT team is ready, can you announce the winners? So, sir, you can tell the quizmaster, sir, results.
Okay, results of South Zone quiz. Okay, the winners of South Zone. The first one is Dr. Kettigaru Mamata from Kannur Medical College, Kannur. Second prize goes to Dr. Agila Reddy from Kakatiya Medical College, Warangal. All from Hyderabad. Is it Hyderabad or from Telangana?
Yeah,
both from Telangana.
Both from Telangana.
So they can work as a team.
Yeah.
Okay.
So you will both be representing. Our team will contact you and share. And for rest of the participants, congratulations, still participating and then playing this game itself was really a good experience here by winner itself. And also you learned, our experts were explaining it was also a learning process from the eminent doctors like Dr. Sukumaran, Professor Sukumaran sir and Professor Dr. Anand Keshavan sir. You learned a lot of things today in this 1.5 hours. So that was also a great experience. Congratulations.
So you're requesting all of you to participate in poster presentation also.
Yeah.
So start preparing your poster, research paper now itself. I send it by the September last or October first week. So
thank you.
Congratulations all the participating team. Also a special congratulations to the winners.
So with the permission of the quiz master, can we stop the live recording,
Yeah.
sir?
Okay.
Recording stopped.
Someone
Good evening, everyone. It gives me immense pleasure to welcome you all to this edition of Fever Foundation quiz, first ever quiz on fever. And thanks for joining in and participating in this quiz program. Before we go live to the quiz, I would like to again tell you about the rules and regulation of the games. We had sent you all these rules and regulation by mail to you, but still I'm going to tell it again so that you'll become familiar with it. So the first rule is that this is for the postgraduates only. So this quiz is only for postgraduate students, and the quiz consists of multiple choice questions. You will have 20 such questions, and each question will have 20 seconds to answer. And the option to be selected by clicking the button on your text panel. So on the right hand side, you have a text panel. You need to click the button on the text panel. There is a video displaying with the option that will be only for representation purpose only. So you cannot click the answer on the video. Please use the text panel to select the buttons displayed in the text panel to answer it. And all the participants are hereby advised not to leave this platform and go to the YouTube. Though we have given the YouTube link, that is only for viewers. You cannot play the quiz there. So if you want to continue playing it, please play here only. Please be on the platform till the end of the quiz program. And so don't leave this platform. Then once you submit the right answer, you will not be, or any answer, you will not be possible to revert it. And there is no negative marks to carried in this quiz, and winner will be maximum fast right answer. Whoever answers it right fast will be declared as the winner. And if there is a tiebreaker round will be played with 3 questions, and that will be done to decide the winner. In case there is again tie, there will be a knockout round after that. And it is advisable to use laptop and desktop for the better experience of this quiz. And next is all of you are advised to participate from a place where there's a good internet connectivity. If found to be any type of foul play, you will be automatically disqualified. You should not use mobile phones for getting answers from any of your colleagues sitting nearby. And Fever Foundation is not responsible for any form of technical error such as poor network connectivity, etc. And participation in this game implies that the participant accept the integrity of these rules, and the participants who have given incomplete or inaccurate personal or contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participation in the quiz and the candidacy for the prize. First and second winner will be played as a team, and you will be representing today the winner of today's program. First and second winner will be representing South Zone, and you will enter the national level quiz at FEFCON 2022 in Bangalore, which is on 5th and 6th November. You will be called to Bangalore. Our Fever Foundation team will make all the arrangement for playing the national level quiz project. And finally, the quiz master and the judges' decision will be final, and we are all binding by their decision. Okay, these are the rules and regs. I would like to introduce our judges on the quiz masters panel to you. Next slide, please. So Dr. Isaac C. Moses, MD, General Medicine, FICP and FACP USA. He is currently the Medical Director of Bethesda Hospital, Coimbatore. He is a Nodal Officer of COVID-19, Government Perundarai Medical College and Hospital, Erode. Former Medical Director of Sri Ramakrishna Hospital, Coimbatore. Former Dean at the Government Medical College Hospital, Chengalpattu. And can I have the slide, please? Yeah. And former head of the Department of Government Medical College Hospital, Coimbatore, expertise in internal medicine with more than 3 decades of professional experience. He has several publications to his credit in peer-reviewed index medical journals. He has contributed several chapters in the medical textbooks, has presented paper in numerous national and international conferences. He is an ardent speaker and developed numerous lectures on various television channels, actively involved in patient education, and he has organized several national and the state conference. Dr. Moses, sir, it's our pleasure and privilege to have you with us, sir. Welcome, sir.
Thank you so much, ma'am. Thank you.
Yeah. Our second judge is Dr. Ravi sir. He's MBBS MD FICV. He's currently the director cum dean and professor and head of the Department of General Medicine at Bangalore Medical College and Research Institute. He's a member of State Authorization Committee for Human Organ Transplant, Government of Karnataka, past secretary of API Karnataka chapter, convener of CME in Internal Medicine, which is a very popular program for postgraduate medical student by Medical Education Research at MART. And he is avid orator with numerous paper presentation in national and international symposium. He had several papers published in peer-reviewed medical journals. Dr. Ravi sir, it's a welcome to you and pleasure and privilege to have you, sir. Next slide, please. Yeah, we have Professor Dr. Nagaraj BS. Sir is Professor of Medicine and Principal Sri Atal Bihari Vajpayee Medical College and Research Institute, Bangalore. He's the Dean of Medical Faculty at Rajiv Gandhi University of Health Sciences, Bangalore. Past Chairman and Honorary Secretary of API Karnataka.
Thank you very much.
Thank you, sir. So, yeah. Thank you, Ravi sir. Past Chairman and Honorary Secretary of API Karnataka Chapter, Associate Editor of Journal of Internal Medicine Research Review and Reports. He's presented scientific papers in both national and international conferences. He has numerous publications in various index, national and international peer-reviewed journal. He is also on the advisory board member of Fever Foundation. Dr. Nagaraj sir, it's a pleasure and again privilege to have you with us, sir. Welcome to you, sir. Then we have Professor Dr. Anupam Prakash. Sir is MBBS MD General Medicine, PGCC Hospital Management, PDC AMS, FACP and FIAC, API Delhi State Chapter, Member Advisory Board of JAPI, JASEM and Journal of Case Report, and he is the advisory member of Fever Foundation. Professor Anupam Prakash, sir, welcome to the show.
Good evening, welcome everybody. Thank you and best wishes to all the participants.
Thank you. Privileged to have you, sir. So we have a Professor Dr. Ghanshyam Pangte, sir, Professor of Medicine at Lady Hardinge Medical College, New Delhi. He's Rheumatology and Medicine ICU in charge at LHMC, New Delhi. Joint Secretary of Indian College of Physicians, API Delhi Chapter. Executive Member of Delhi Rheumatology Association, ISCR, Associate Director of API Textbook of Medicine, 9th and 11th edition. He has published more than 100 indexed, non-indexed articles in reputed journals. He has co-edited several books and some of them are pures of scientific paper writing, research methodology and ethics in clinical research under PRF. And he is a Medicine MD, NBE, postgraduate teacher as well as examiner of Delhi and AIIMS, Rajasthan. So Professor Dr. Ghanshyam, sir, it's a pleasure and privilege to have you with us, sir. Welcome to
Namaskar, ma'am. Thank you, ma'am.
Thank you, sir. So we have Professor Dr. Shubha Lakshmi Margekar, Madam. She is Professor at the Department of Lady Hardinge Medical College, New Delhi, Fellow of Indian College of Physicians, Fellow of Association of Clinical Medicine, Coordinator in Chief of Thalassemia Adult Daycare Center and Thalassemia Transition Care Clinic at Lady Hardinge Medical College, New Delhi. She is a recipient of Dr. J.C. Patel and Dr. B.C. Mehta Award in Epicon 2014. She has been the faculty in Epicon 15, 18, 2019 and 2020, faculty and organizing team member of API DSC CME 2019. She's been the faculty and organizing team member of Diabicon 15, 16, 17, 18, 19, consecutively 20, and delivered lectures in Epicon, Diabicon, and various other CME of national and international reputed conferences, participated in several multicentric international clinical trials, guided a 12 PG student for their thesis, and has several publications to her credit in very indexed and reputed medical journals and books, and also she's been part of API Textbook of Medicine and Medicine Update. So Professor Dr. Shubha Lakshmi, once again, welcome to you, ma'am. Pleasure to have you with us, ma'am.
Thank you, ma'am.
And we have Professor Dr. Ramesh Agarwal, sir, MD Medicine, FRCP UK, FICP MNAMS, presently working as Professor of Medicine at Lady Hardinge Medical College, Associated Hospital, New Delhi. Is a recipient of prestigious Srimati Pawan Kumari Jain Oration Award for outstanding work in the field of internal medicine. He's chaired session and delivered lectures in various national and international conferences, some of the national conferences being Diabicon, API, DSC, Epicon annual conferences. He served on the board management of Delhi Diabetic Forum. He has more than 70 publications in national indexed international journals, and he has chaptered several books, and he's been the speaker in various national and international conferences. So Professor Dr. Ramesh Agarwal, sir, once again, welcome to you, and
Thank you, ma'am.
pleasure
Thank
and
you.
privilege
Thank
to
you,
have
ma'am.
you with us, sir. So these are our panel of judges and the quiz masters. Now with this, I hand over the session to our quiz master. Over to you all, sir. Dr. Anupam, sir.
Well, a very good evening, everybody. And at the outset, Dr. Manjula has already conveyed the rules, communicated the rules to all of you. And I again wish you all the best. So happy quizzing. But before we proceed with the quiz in original, we have some dummy questions for you. So I will request computer you to start with the dummy questions. So you will have 4 options for each multiple choice question, and you will have to click the correct answer, and that answer has to be the earliest that you can, and that has to be correct also. So correct and the fastest. So the fastest finger gets the award, and that is how we will actually calculate. So every question which is answered by a person, and the first person to answer that question correctly, that cumulatively over a period of 20 questions, that will be evaluated. So we will start with the dummy questions, and again, all the best from all of us. So here we are with the first question of FCON 2022 South Zone Quiz. Find the odd one out among the following: Facebook, Twitter, Google, Instagram. So your time starts now. So you get 20 seconds, and the person who answers it fastest will get the award. But not on this question. This is a dummy question. But yes, you will get an opportunity to test your choices out here. So just press a button and you will come to know that yes, your system is working fine. So there are 4 options, and those who are net savvy, and even those, I think this is not a very difficult question for everybody. But still, I was wondering, I was told that this question would be tougher than the previous 3 days, but probably this is the only question which I know out of the dummy questions in the last 4 days. And but unfortunately, I cannot click it because I am the panelist. So I don't get any marks for this. But computer ji, can we have the correct answer? So I wondered Google must be the answer, and the reason obviously I can give, but I think it is obvious to everybody that Google is not an interface and a social media which is can be used, but the other 3 are social medias. So I have an explanation for only one question, and I know the other 2 questions would be out of my domain. But anyhow, can we have the persons? How many of us got it right? Oh, so many of you, 91%. I think in the last 3 days, we never got this high an answer, correct answer. So anyhow, we are in for trouble. That means let us see how it goes today, and let us see how it pans out. So can we have the second question? So what is the scientific name for modern humans? Homo sapiens, Homo magicians, Homo technicians, Homo genius. So your time starts now. Now this is a very difficult question because obviously all the 4 options could be correct in this. If I were to be asked, so I would say yes, there are many of us who are genius, and this species of human beings is probably the most intelligent of all the previous species, although we didn't have tools. So your time ends now, and we will have the answers again. So computer ji, answer bataएं please. Please let us know the answer. Homo sapiens. But yes, there could be a difference. But in this case, the quiz master's decision would be final. So Dr. Nagraj and Dr. Moses would do the job. But I would say Homo magicians is also true. Yesterday we were amidst magic only. We were discussing about that. And yes, we are technical people, especially doctors, and all those are professionals. So all four choices could be correct. But since Dr. Nagraj and Dr. Moses seem to be pointing towards that I should keep set and go with the answer of Homo sapiens, so we will go by that. Let us see how many of you got it correct. Computer ji, please show. So 91. So this is very important that 90% got it correct and some have got incorrect. Now these incorrect answers are very important. If everybody is getting correct, then we will not know that all the keys are functional. So those who give incorrect answers are the real persons who are giving us the indication that our system is working fine. So we had 1%, 1%, 1% in question number 1 also. And here also we have the other two options correctly. So I think everything is functioning fine, but still we will go to the third question today and have a look. Third dummy question, computer ji. What is the most consumed drink in the world? Tea, coffee, beer, water. So your time starts now. So the answer may be easy, but at times the other options are more confusing. So that is the real trick. You have to separate the grain from the chaff. So your time ends now. And let us see how many of us got it right. What is the correct answer, computer ji? Water. Oh, so, but there are different types of water also. Some people have still water, some people have sparkling water, then some people have aerated water. All those types are there. So maybe, I don't know. But still, I agree with whatever the decision is, and we go by water. And how many of us clicked water? Let us see. Computer ji, please show. Display kar dijiye, please.
Recording stopped.
So computer ji is also. See, again, this is a check. So those of people who are putting A, B, C, they are giving us the clue that yes, all keys are functional. So now I think we can proceed with the main quiz, and I will hand over the baton to Dr. Ghanshyam Pangti, who is a senior professor, and he is a very masterful magician, homo magician, as we were talking, and a homo technician also, because he has that technical expertise of dealing with quizzes. And Dr. Ramesh and Dr. Shubhlakshmi, they have been conducting FEFCON. All these three persons, they are all homo technicians, homo magicians. And that is why the answer, I still beg to differ with whatever the homo sapiens is. So there is homo sapiens, sapiens, or homo sapiens, hominis types. So there will be all types. So there will be different varieties. I think I will ask the quiz master to, next time, whoever has framed, to add those varieties also, where hominis. So where magician, where technician, variety technician. Okay, Dr. Moses, that is a request for next time. Dr. Nagraj and Dr. Moses. Well, thank you. The baton is on to Dr. Ghanshyam now. Thank you.
Thank you, Dr. Anupam. Thank you very much. And we are ready for the quiz. And I will just like to highlight that this is a Fever Foundation quiz. And this is the 4th day. So we have completed East Zone, West Zone, North Zone, and today is the final zonal quiz, which is South Zone. And with this, we will have 4 teams, which will go to the Fever conference in November. I think 5th and 6th of November is the final date. And we have expert here, Dr. Anupam, you have already met. And we have expert in the background also, like Kaun Banega Crorepati. We have Dr. Moses here. We have Dr. Nagraja here. We have Dr. Ravi here from South, and we also have Dr. Subbalakshmi and Dr. Ramesh here. And these all, there will be 20 questions overall in this quiz. And if they are, we have to select first and second prize for that. And if there is a tie break, we will have 3 more questions. And you have to do fastest finger first in all the questions. Whoever has the maximum number of correct answer and fastest will be the winner, first and runner-up. So best of luck to all of you. And in between, after the question and answer has been logged, we can take expert opinion and expert advice during the presentation also. Okay. So I will request, and these questions are put on by our computer G, the one of the brilliant software here, and it's all random. So it's not the quiz master who will be confirming the answers. It is the computer G who will say this answer is correct. If you have any issues, you can mail it to our Fever Foundation. But rules are there. Computer G is the final authority to give answer correct, and it will be the most appropriate of the 4 answers. We will request computer G to put on the first question. We already have dummy questions. So here comes the first question for South Zone Fever Foundation quiz. Which prostaglandin mediates resetting of temperature? So in hypothalamus especially, is it PGI2 or is it PGE2 B option? C option is thromboxane A2 or it is PGA2. Your time starts now. This is regarding fever and hypothalamus involved. Okay, your time is over. So we have completed the answer sheets and the computer has logged it. And there were 4 options. So prostaglandin, although there is a thromboxane A2, all are related to arachidonic acid pathway metabolism. So I will ask computer G to just show us the correct answer. Okay, so correct answer was B. So we all know that PGE2 is one of the important factor which causes fever, and it is activated when there is a release of pyrogen, mainly inflammatory cytokines like IL-6, tumor necrosis factor. These all may be related to that, and this PGE2 levels get raised in especially blood circulation, reaches hypothalamus and reset the hypothalamic temperature. So, and other than that, PGI2 is, you all know, it's a vasodilator mainly. It is also used in a lot of condition like pulmonary artery hypertension. Thromboxane A2 are especially platelet activator, and PGA2 is another platelet activator and a vasoconstrictor also. So I will request computer G to give us the percentage-wise distribution, how many students correctly answered the question, and is very, very, very heartening. 77% of the students know molecular level of prostaglandin things. And we all know that whatever antipyretics we are using, they all inhibit prostaglandin only. So naproxen, we have Dolo also. They can all inhibit the prostaglandin here. And we can have some expert opinion before we look on to the winner of this question number 1. We have experts here who want to add anything, sir?
I think the answers, most of them have got it in the right angle to be the very first question. So the PG2 is very nice, very good.
Great. Good, sir. So can we have the winner for first question, computer G? It's a Lalita Samayam. Congratulations, Dr. Lalita. You are the first winner for the first question of South Zone quiz. And with this, we'll go to the second question. Computer G will ask you to just put on the second question. Thank you, computer G. So this question is, how does age affects baseline human temperature? We all know that with aging, there is some change in temperature of the body, especially baseline temperature. So A option is lower by 0.02 degrees centigrade for every 10-year increase in age. Second option or B option is lower by 0.15 centigrade for every 10-year increase in age. The other 2 options are higher by 0.02 centigrade for every 10-year increase in age. And the D option is higher by 0.15 centigrade for every 10 years increase in age. Your time starts now. You have to do fastest finger first. A, B, C. Thank you, Computer Ji. So his time is over, and we will lock the answer. And any of the expert will like to add something, or we can ask the Computer Ji to just first highlight the answer.
Sir, clue is younger hot-blooded. That will be a clue, sir.
Yes, correct. So Computer Ji, just show us the answer first. SA. So body temperature usually gets lower down by 0.02 degree for every 10-year increase in age. This may be related to maybe body composition like BMI and all. Less of skeletal muscle is there in elderly. So person when ages, like especially after 65 years of age. So after every 10 years, there is decrease in temperature because of maybe a decrease in body fat also. So I feel this was slightly difficult question, not a routine medical practice. I think our expert will also go with that. But we should see how many of our students were able to do this difficult question. We will see the percentage wise. This is more important percentage than winning the question as such. 45.38, exactly correct. So we have a majority of population. We know that this is the correct option. Body temperatures decreases with age. Very good, and exactly 0.02 degrees centigrade. And Computer Ji, can we have the winner for second question? Lalita Samyan. Oh no, great. Congratulations, Dr. Lalita. So I can see that there are more than 200, 250 students who are logged in, and Dr. Lalita has already won 2 out of 2. So she has very high chances of winning this quiz, but best of luck to everyone. We will ask Computer Ji to put up some more difficult question. Can we go for a third question? Okay, here comes the third question. The dose of human rabies vaccine by intradermal route at one site. Okay, so intradermal route is the clue. Is it 0.1 ml? Is it B option 0.2 ml? Is it 0.05 ml or is it 0.01 ml? Your time starts now. Nowadays, a lot of people are using intradermal route also. Thank you, Computer Ji. So we have logged this question also, and I think rabies is very common in India. And recently there has been a lot of news from the south. And first we'll log the answer and we'll ask Computer Ji to just highlight the answer so that we can proceed with that. Okay, it's a 0.1 ml of intradermal dose, usually given in 2 sites, 2 deltoid. And intradermal is slightly tricky, so we need an expert who can give this. And recently there has been incidents of a lot of dog bite in Kerala, especially south.
Exactly.
Our expert will like to hear from them, sir.
So, recently, about last week, I think we had a lot of dog bites in Kerala, so especially Trivandrum, where there were a lot of rabies patients.
Yeah, so we heard from newspaper that dog killing and dog capturing is going on, and a lot of animal rights activists are not happy with that. But rabies is the only disease which is 100% killer disease. So we have a preventive thing. We have a vaccination here. I think most of the students will be having correct answer in this question number 3. Computer Ji, just show us the percentage wise. 53. It's a majority of students have answered correctly, but still we can see that some students were still making slightly different dosing. The good thing of intradermal dosing is we are reducing the amount of drug. So we are saving on dosing. Normally it is given at 0.5 ml to 1 ml of intramuscular dose previously. Now this regimen, even India, I think WHO as well as Thai group has suggested this, and it is now routinely followed. I think Kerala also may be following this intradermal route. And we'll go for question number 4. Rabies was a good question. I think people will learn intradermal dosing. Student will learn, sorry. Computer Ji. Oh, sorry. We have a winner here and we have a second winner. Sorry, Dr. Balu, I'm really sorry. Second answer is second winner we have is Balu Subramaniam, and he's won third question. So two winners we have already in line, and congratulations, Dr. Balu. And he's taken just 2 seconds. Can you imagine? Just 2 seconds. Okay, great. Fastest finger first is the key for winning this quiz. We'll go for question number 4. Here comes question number 4 of Fever Foundation. For how long drug is required to be discontinued to rule out drug fever? So it's a drug fever question, and we need exact time when we can call is it drug fever or not. Is it 24 hours? Is it B option 48 hours? C option is 72 hours, and D option is 96 hours. Your time starts now. A is 1 day, B 2 day, 3 day, and D 4 days. Thank you, Computer G. So we have 20 seconds to answer this, and fastest finger first has already taken place. And Computer G will let us know, is it 2 days, 3 days, or 4 days? I think 24 hours will be a very short period. Computer G, 72 hours. So as per Computer G's calculation, until unless 3 days has passed after withdrawing the drug, we cannot call it a drug fever. I will like to have some opinion from our experts, because drug fever is very common in our practice, and a lot of antibiotics like beta-lactam can itself cause fever instead of treating that. So anything you want to add to students?
Especially, penicillins and all antibiotics. Better we have to stop these drugs. Penicillin, cephalosporins, very commonly used antibiotics. Unless we stop, we'll not know whether it is drug fever or not. When you have got a doubt with your clinical examination, investigations, still if you are not getting a clue, best thing is to stop these antibiotics and see. Yeah, exactly. As sir said, 72 hours, but usually after removing the drug, within 24 to 48 hours, majority of patients do respond in drug fever. But you have to see clinically also, some patients who are very sick and you suspect drug fever, so there should be a very strong suspicion of drug fever, because in a disease, India is endemic for infectious disease. Patient comes very late, and making a drug fever, which is still a rare or uncommon disease compared to a infectious disease. So you have to see clinically also before making a judgment.
Yes, I would add on to Dr. Kansham saying that clinically also you have to watch, because waiting for 72 hours at times may be a little longer. So you'll have to see the condition of the clinical condition of the patient and then assess as to whether it is 48 hours or 72 hours.
Exactly. As Dr. Moses said, you have now some tests also like Procel and all, which can say that, okay, infection is there or not. It can help you. And we will have Computer G. Just let us know how many percentage of the students feel it's 3 days. We should wait for 3 days. Okay, 3 days is 39. Now it's not majority. So some students still feel it 2 days is good enough. And as such, 48 hours is good time, but it is discontinuation. So you have to wait for at least 3 days to label it as a drug fever. And can we have the winner for question number 4, Computer G? Veena H.A. Congratulations, Dr. Veena. And she has also taken just 2 seconds. So we have third person who has entered the merit, and now competition has increasing, and hopefully some more winners will be there very soon. And we are just less than quarter of the quiz is over. And next question, Computer G. We'll go for question number 5. Okay, Computer G is a slightly difficult question. In cyclical neutropenia, fever recurs in every dash days. So it's a cyclical neutropenia. And is it every 7 days there is a fever? Is it 14 days? Is it 21 days? Or is it 28 days? Cyclical neutropenia. Your time starts now. So Computer Ji has given a difficult question out from his big question bank. And I personally feel it is a pediatric question, cyclical neutropenia. It's a hereditary disease commonly seen in children. And we all are adult physicians. And children quiz is already over by 4 o'clock. They started at 4:30 and they have already had a South Zone winner. And Computer Ji, can we have the answer first? Okay, so Computer Ji says that in cyclical neutropenia, fever recur every 21 days. So around 21 days it takes to have a fever. Again, they improve after 3 to 4 days. And again, there's a fever. And fever most likely may be due to neutropenia, because neutrophils are the your defense against those microbes. Our experts, sir, do you think it will be a difficult answer for physician, or not rational to give pediatric question to physicians?
Can ask little difficult question.
Yes.
For a physician, anything can be asked. That is the problem.
Okay, we have to make difficult, because otherwise it will be 100% answers. So this is cyclical neutropenia. Yeah, it's a hereditary disease. So you should take a family history also. And there's some gene involved, which is related to some elastase of neutrophils. I still feel it's a pediatric question, but as Computer Ji is the master, we cannot change anything. So Computer Ji will let us know how many students are able to give correct answer C. Oh, great. Majority. Again, we have a majority of students, more than 50%, has correctly said it's a 21 days. They are reading very well, or they have a good friend sitting nearby who are helping them. And still, whatever, but I was told that we have a software here which can detect that anyone is Googling around. So just be cautious. If we came to know that one more IP address is being used near this quiz, he will be debarred, or she will be debarred. So Computer Ji, can we have the real winner for question number 5? Difficult question, cyclical neutropenia. And we have another winner, new winner, Dr. Nisintha A. Congratulations, Dr. Nisintha. And all the winners are just taking 2 seconds. Next time we will reduce 20 seconds to maybe 5 seconds, because most of the students are just taking 2 seconds. We will save our time also. We are sitting here for last 4 days, so we want to complete this as early as possible. Congratulations, Dr. Nishinta. We are one quarter of the quiz is over. We have 4 winners for last 5 questions. We will go for 6th question. Computer Ji, kindly show us the 6th question. Okay, it's a diagnostic criteria for neoplastic fever, cancer-related fever, or all true except. So this is the except question. Just remember, all are true except for one thing. Is it a temperature over 39 degrees centigrade at least once each day? It's 39 degrees centigrade, A option. B is duration of fever over 2 weeks. Is it C, absence of allergic mechanism? Or is it D, lack of response to fever to an adequate antibiotic therapy for 7 days? So it's accept question. Your time starts now. Okay, your time is over. So it's a neoplastic fever, like a paraneoplastic syndrome. Although some of the cancers like leukemia, lymphoma may be associated with infection. So we are not talking about infection due to immunocompromised status. Computer Ji, just let us know what is the answer first. We'll discuss after that. Again, slightly tricky question. Okay, according to Computer Ji, it says temperature over 39 degrees centigrade at least once each day is a wrong answer, or a correct answer for this, but option is wrong for this. Rest all are seen in neoplastic fever. Duration over 2 weeks is correct. Absence of allergic mechanism should be ruled out. There should be ruled out. There should be adequate trial of antibiotic also to say that it is not due to infection. So first option is correct. And I personally feel there was similar value for this. I think temperature, computer G has changed the temperature. The value is each day there should be fever, but temperature should be slightly lower. If you convert 39 degrees centigrade to Fahrenheit, it comes around 102 plus fever. So it's not very high grade fever in neoplastic fever. It is around 38 point something, I think 38.4, slightly lower side. So it's a tricky question. Just because of value, I feel difficult to make it out. But computer G, let us know how many students are still able to make it out. 38.5, 4 is different from 39 degrees centigrade. Okay, 30%. I already told you it's slightly, all options are good number of students. I clicked all the options. A was the correct answer. Our experts, neoplastic fever, how common it is. Very few cases we have seen. We are an internist, not a medical oncologist as such. Very few patients I have seen. Okay, so Tom Anthony, new winner for this question number 6. Our competition is increasing. And as I said, he took 4 seconds to answer this. And it's appropriate, exactly. I personally feel it was a difficult question. And 4 seconds is good time. Congratulations, Dr. Tom. We'll go for question number 7. Okay, so again, it's a negative STEM question. False about typhus fever. So typhus fever, nowadays, a lot of cases of typhus fever are cropping up even in North India and South and other these forest area. Already you have a lot of typhus. So question is false. What is false about typhus fever? Is it Weil-Felix test can be used after 1 week? B option, Weil-Felix test can be used before 1 week. C, Weil-Felix test has low sensitivity and low specificity. Or a D option, ELISA has high sensitivity and specificity. Your time starts now. It's one of the false statements. Time is over. So question number 7 was typhus fever test. And as you can see, A and B option are just antagonistic. One of them should be positive. And let's see how many students are able to make it out. Is it first or second? I think it's maybe more than 90% or maybe 100%. Computer G, answer. Okay, so Weil-Felix test can be used before 1 week. Is a wrong answer. It's a false statement. As you know that most of the antibody tests should be done after 1 week. So it's a clear-cut option, and A and B were. So computer G has given an easy question after giving 2-3 difficult questions. And sir, are you using Weil-Felix test or anything you want to add about Weil-Felix? Very low sensitivity, specificity as per data.
Very low sensitivity, sir, but not using it much.
Yes, sir. So nowadays, ELISA test is more commonly used.
ELISA.
People use PCR test for diagnosing. So can we have percentage-wise distribution? I think maybe 100% students are correct. B. It's all depend who was the fastest finger first. Computer G, let us know. Okay, exact 65%. Still, some students are maybe they have a sticky finger. They are just clicking left, right around B. So computer G, let us know the winner also. I think it will be less than 2 seconds or maybe 1 second. Okay, we have a Dr. Vishnu here as another new winner. And congratulations, Dr. Vishnu. And he has answered in 4 seconds. Good. He has at least waited to read all the 4 options at least. Okay, so Weil-Felix test already written low sensitivity, specificity, and ELISA is better sensitivity and specificity. But if you want to have a better diagnosis, go for a nucleic acid test or a PCR test where you can confirm those things, not only by antibody. And we'll go for question number 8, sir. Computer G. Question number 8. Can we have on screen, sir? Oh, we don't know. Computer G, maybe madam also. Computer G. Okay, so Computer G has given another question number 8. geriatric fever score. There's a geriatric fever score is calculated using which of the following predictor? So here they want to know there's some calculator or some scoring system is there which can detect mortality, especially in elderly patients, especially 28 days mortality. So what are the parameters which may help you detect that this geriatric patient may die if these parameters are wrong or raised or abnormal? Is it A, lactic acid, severe coma, tympanic membrane temperature? A option. B option is leukocytosis, sepsis, thrombocytopenia. C option, leukocytosis, severe coma, thrombocytopenia. And D is lactic acid, sepsis, tympanic membrane temperature. Your time starts now. Okay, so time is over. Computer G has given question from geriatric medicine also. Geriatric population, some people take it 60 years, some people will take 65 years, and they have different comorbidity. They are more fragile. So Computer G will let us know which are the parameters which may help you in detecting that patient will die if admitted with these complications or these abnormalities. Computer G, can we have the answer? Okay, so as per this study of geriatric fever score, if patient has abnormal leukocytosis or patient is in severe coma or thrombocytopenia, they have high chances of mortality in hospital mortality, especially if we take ICU mortality as 28 days mortality. So this study has suggested maybe high mortality. I'm not sure what are the other parameters used, but Computer G says these three are proven parameters. A lot of our internal medicine people are gerontologists also. So, sir, any of the center from our India or maybe South, sir, you want to add something, sir? Scoring
what
system.
you have to keep in mind, especially in elderly population, absence of fever will not rule out infection. So many a times, even though they have got infection, absence of fever may be there. So always a high degree of suspicion must be there of infection, even in absence of fever in these population.
Yeah, it's a great point, sir. Said that you should take elderly as a maybe immunocompromised patient. So they may not have fever, they may not have even leukocytosis. So you should suspect there should be high clinical suspicion before making a diagnosis of infection, especially in elderly. So Computer G, how many % of the students were able to make it option C, correct option? We all are learning this difficult scoring system. So not majority, but almost equivalent to the two group C and D. So correct option was C. And Computer G will let us know the winner also, who is interested in geriatric medicine. We should be able to know. Computer G, can we have the answer to the this Sandeep Ganga? Okay, so we have another winner, and he is clearly took only 4 seconds to answer this. So leukocytosis, severe coma, and the third option was I forgot. Okay, so C was the option. We'll go for question number 9. I think thrombocytopenia was the third option, correctly. So we are question number 9 from Fever Quiz 2022. Patient presenting with fever and chills, least likely cause of fever. So all can cause fever with chills except for one. Is it A, pneumonia? Is it B, urine tract infection? Is it C, cholecystitis? Or is it D, systemic lupus erythematosus? Your time starts now. Computer G, time starts now. Okay, so time is over. Computer G has logged the question number 9 and answer number 9 also. We will first like to see the answer. I think 3 of them are almost infection and one
Exactly. Very nice.
SLE is the correct answer. And it's difficult to make it out because SLE is a immunocompromised status. Again, a lot of patients may be on disease-modifying drugs, steroid, and they can develop infection also. So differentiating between infection versus inflammatory cause of fever will be difficult and challenging. We will ask our expert how they do in their clinical practice. While as per this, you can see fever with chills, pneumonia, cholecystitis, especially upper urinary tract infection can cause chills and fever. Other you already know malaria and anywhere there is abscess like empyema, they can cause high-grade fever with chills. SLE, sir, can you highlight, sir, how to differentiate fever in SLE, inflammatory versus infection? If you want to add, sir, something. Although activity of SLE, we can have some tests, sir.
Clinically, fevers with rigor, the first option would be always urinary tract infection. And of course, we find cholecystitis also presenting with fever, sweating, severe abdominal pain. And then third option, as I said, is pneumonia. So the presenting with fever, least like cause is very evident that SLE is the least cause in the given answers. SLE, as you already mentioned, giving steroids and all that can be more prone to cause infections of any type because the immune system is suppressed. And so thereby they can present with fever, which can present with chills, very rare cause.
Yes, sir. Thank you, sir. So it's a non-infective cause, which is less likely to cause chills and rigors. And fever is there. A good number of patients will have fever. And few tests are there. They may help you that it is activity of SLE, not infection, like complement level. So usually it's an immune complex disease. Complement C3, C4 will be reduced in SLE activity. Another feature, there may be lupus nephritis, there may be malar rash, a patient may be having a CNS lupus. So these features are there. You can say it's activity. While if you have other parameters, and lymphocytopenia will be another indicator that it's a activity of SLE, not infection, because lymphocytes usually get reduced in SLE activity. But still, again, it's a clinical decision, and when you see patient, is at times it's very difficult to make it out. And we usually give antibiotic support, and then we keep on evaluating. So most of the patient will get both the treatment. So Computer Ji, can we have percentage of the students? I feel majority will be having correct answer. Great. So 88% of the student already know that it is SLE, which is rarely can cause chills or very, very unlikely. And can we have the winners, Computer Ji? Question number 9, winner for South Zone is Siddharth Raghu. Congratulations, Dr. Siddharth. And we have another winner here. So competition is increasing with every question. And Computer Ji is going to give more difficult question because you are just taking 3 seconds to answer. Okay, Computer Ji, we'll go for a 10th question. It's a halfway stage. Question number 10, we have total 20 questions. Question number 10 is, what approximate percentage of patient with febrile neutropenia will have a positive blood culture? So here, there's no mention of is it in Indian study, international study, but most likely you can take it as an international standard. Is it a 70 to 80% will have culture positivity? Is it 50 to 60% B? C option is 10 to 20%, while D option is less than 5%. Your time starts now. Febrile neutropenia. Time is over. Computer Ji has logged the answer. And if we see, we all should take precaution and take timely blood cultures before giving antibiotics. And we all know that febrile neutropenia is an emergency. You have to start antibiotic as early as possible. And usually there is a SOP for protocol for giving antibiotics, which antibiotic to be started according to your institute culture sensitivity report. And if you see Indian standard, maybe least number of patients will have blood culture positivity. And Computer will let us know what is the international standard for this. There's a gross difference from 50, above 50 and less than 10%. So Computer Ji, let us know answer. So I feel if you see the percentage, most of them must have guessed is 20 to 10 to 20%. Even Indian standard will be something somewhere here, and on the lower side maybe 10%. International maybe 20%. And with new culture, these whiles we have backtech and all, culture sensitivity is improving with knowledge also. People are taking sample timely. And sir, it's over to you. You want to add something about febrile neutropenia, sir? Any Dr. Nagaraja or Dr. Moses, sir? Till we have computer G assesses the percentage-wise distribution. So we can have a percentage distribution. Okay, so 35% still feel 50 to 60% cultures are positive, which is rare in real life scenarios. Correct answer, majority are still say 41%. So C option was the correct answer. And can we have the winner? Swati Maya. Okay, congratulations, Dr. Swati. And she has correctly guessed the answer in 3 seconds. Very good option selected. 3 seconds, and option was also 3. C. Congratulations, Dr. Swati. We'll go for a question number 11. So we have almost over halfway stage. We've come to question number 11. Computer G, we'll go for 11 number question. Okay, so question number 11 from the big question bank of our Computer G. Which of the following is false regarding the new definition of FUO? This is false statement given by Durek and Street in 1991. So there is one more before that there's a definition. This is latest or a last one, 1991. False statement. Fever more than 38.3 degrees centigrade on at least 2 occasions. A is a false statement. Non-immunocompromised status is a false statement. C, illness duration more than 3 weeks. Is it a false statement or a diagnosis uncertain after thorough history, physical examination, and obligatory investigation? Your time starts now. You have to see false statement. Computer G, timer. Thank you, Computer G, for locking the screen. So this was, I think, a slightly easier question. Most of the students must have answered correctly. And Computer G will let us know, is it true? Most of them guessed correctly, because false statement, whenever you get, it creates a lot of problem for students' mind. Computer G, can we have the answer first? Okay, so it's a non-immunocompromised state, which means patient, this classification, Durek and Street, 1991, that means almost 30 years back they have made this definition, and they have made a different classification. Immunocompromised status should be different. They use a different classification for this. So this was the false statement. While before that, I think first FUO definition was almost 30 years before 1991, almost I think 61, 60 somewhere, and that was by Petersdorf, and there he has not make a different classification for immunocompromised status and HIV. So, any expert want to add, sir, something? These fever, FUO.
This FUO is one of most challenging and difficult situation to be faced by a physician. And as one of our mentor, Dr. Maya tells, it will remain unknown. This cause for FUO will remain unknown if fever subsides on its own or patient dies. So it's a very difficult, challenging problem for a physician.
Exactly, sir. Dr. Nagaraj has already said that this fever foundation is made especially for these challenging FUO cases only. So we can have a CPC on these challenging cases where not only infections, although there are atypical infection, difficult to treat infections, but still FUO, which maybe have a malignancy, which may have a autoimmune disease, are the real CPCs. Which are discussed and made diagnosis by clinicians, expert clinicians. Sir, you are muted, sir. Dr. Ishaq, sir.
Yes, sir. I just wanted to add one more point to what Kanchan said, that hypernephroma is one condition where you will always miss fever which is coming there. So we had one professor in Chennai who was teaching about fever, and he himself had hypernephroma, and the diagnosis was made. Just to highlight on FUO.
Yeah, there may be another question on this hypernephroma, sir. So you have already guessed the question, maybe because quiz is our computer G has vast question bank. Dr. Subbalakshmi or anyone want to add anything FUO? A lot of questions were there from FUO. Dr. Ramesh or anyone?
Yes, sir. This FUO, as in last few days also, we have done many questions on FUO, very common topic and very difficult also, because we face very many challenges. And as in this also, it is like known immunocompromised state, that is HIV associated FUO. So it is for HIV associated FUO, it is 3 days. It is not 3 weeks, it is 3 days that the timeline has been used by the definition. So that's why it is false in this statement, this thing.
Thank you. That's why we have expert here, like expert with Amitabh Bachchan. So I don't have those great expert, but we have a good clinician here who can help us that 3 weeks. Usually it's very difficult to get those figures like 38.3. So good thing is like you can remember 3 is important thing. 38.3 has a 3. Illness 3 weeks as a 3, and madam said 3 days for immunocompromised yes. HIV infection. So this may be a mnemonic to remember, and this will help you in memorizing during the MCQs, especially in
yes, sir. New things to learn. 3.
Yeah,
3 in FUO.
3 is very important, I will say.
Yeah.
So, computer ji, can we have the percentage distribution? Okay, so answer was B, and exactly 74%. Good number of students are correctly guessed. Although false stem questions are, I always say, tricky and should be avoided. Whoever makes the question, I will request computer G to give false stem question at last when you finish with all true questions. Okay, so computer G, can we have an answer also? Okay, so Dr. Siddharth Raghu, I think he has won this second time. His name has cropped up for the second time, and he's just taken 3 seconds. Good, Dr. Siddharth, congratulations.
Again, this 3, sir.
Okay, 3 seconds, one more.
Yes.
Okay. Great. So it's matching 333, and we will have 12th number question. So, Dr. Subbalakshmi, also you also add up, ma'am, so that we can have a broader discussion.
Yeah, sure.
Okay, so here question number 12, CDC stage 3, which is AIDS, defining opportunistic illness in HIV infection, are all except. So this again comes the except question. Everything is an AIDS defining disease except for one. Is it A, candidiasis of esophagus? Is it lymphoma, Burkitt's lymphoma, or equivalent term? Is it salmonella septicemia, or is it CMV involving liver, spleen, or nodes? So it's a false statement except. Your time starts now. Thank you, computer G. So we have these options for HIV definition, not AIDS definition. So AIDS definition, one is CDC criteria where you have CD4 count less than 200 with HIV positivity, we call it AIDS or acquired immunodeficiency syndrome. Second is AIDS defining diseases, and any of the expert will like to, first we will lock the answer. Computer Ji, give us the answer. All looks very familiar or very similar. Okay, so this says CMV infection of liver, spleen, and nodes are not AIDS defining. Rest of all 3 are AIDS defining criteria. I would like to take help of our experts to just give us a brief. What are the other AIDS defining criteria and why CMV, spleen, liver, and nodes are not there? I think some CMV infection was there in AIDS defining. Any of the experts want to add up something? Okay, so yes, sir.
Other malignancies also age defining?
Yeah, correct, sir.
NHL.
Yeah,
And also CS cervix also is recently added.
Yeah, CS cervix, sir, invasive CS cervix is one of the criteria. Burkitt lymphoma is already given by computer G. I think primary CNS lymphoma is one of the AIDS defining criteria. Tuberculosis, if someone has a tuberculosis with HIV, we call it AIDS defining. And candida, especially oral candida, is not in criteria, while esophageal candidiasis or candidiasis septicemia is there. And I think CMV is there in which if it is involving the eye, which is causing the vision loss, or maybe a CMV of GI tract is missing here, which can cause severe gastroenteritis and they can kill the HIV patient. So it was a tricky question. CMV is there, we all remember, but liver, spleen, and nodes are not there. So if someone has this thing, this may be asymptomatic presentation because CMV seropositivity is very high. I read somewhere it's maybe depending on area, maybe 60% to 100% may have a CMV positivity. It all depends on how is the immune system of that patient. Computer G, can we have the percentage distribution of students who guessed this tricky question? Oh, it was really tricky. So D option was only 20%. So second, only 1/4 of the students were able to make it correct answer. Difficult question, but age defining is important. CDC age defining criteria. If you have a HIV patient, you will get that, and all the examiner will ask you what are the age defining criteria. I will request Computer G to also give us the brilliant student who has guessed it correctly. 20% only, they are the minority here. Age defining criteria, and Dr. Monica N has correctly guessed that CMV of spleen, nodes, and liver are non-specific in HIV patient. It may not lead to severe CMV septicemia or organ failure. She took some extra time, not extra, it's 1/4 of the 20 seconds, but compared to previous answers, she has taken 5 seconds and good 5 seconds. And because everyone has taken less second, but a wrong answer. Computer G, we have completed 12 questions and we have 2-3 students who have answered more than one. We still have 8 questions. Computer G will go for 13 questions. Okay, so 13 number question is, which of the statement is incorrect? So again, it's an incorrect option about erythema infectiosum, because you all are sitting at home. So Computer G is also playing trick with you so that you cannot take extra help from anywhere else. So erythema infectiosum, incorrect statement you have to tell. In pregnancy causes fetal hydrops and fetal death. B option, resolution of symptoms followed by slap cheek appearance. It causes slap cheek appearance. Causes prodrome, may include fever, sore throat, and anorexia. Also called Sixth disease. Your time starts now. Time is over. Thank you, Computer G, for giving that difficult question from the pediatrics again. So I personally feel fever with rash, especially in children, so many rashes are there. It's very difficult to make it out. For a physician, it's taking nail out of a hay, and it's very difficult, I think. So Computer G, first let us know the correct answer. We can discuss it after that. What is the correct option? Erythema infectiosum. It is not correct. It is incorrect option. So all the 3 are correct except for the option which Computer G is giving. So it's not Sixth disease. It's something else disease. Erythema infectiosum. Computer G has given very difficult question, and I personally feel again the student will be in a minority. Sixth disease. If I remember some amount of pediatrics, they were first disease, second disease, third disease, fourth disease, and fifth disease, and this is the sixth disease they are saying, and it's wrong. So most likely it's fifth disease, erythema infectiosum, while sixth disease is something else. I think first disease was measles, and it's a long classification, nothing to do with day of rash. But in medicine, we should know fever with rash, dengue. We should know fever with rash, maybe herpes and all. But computer ji want to ask you even pediatrics question. So anyone of you, sir, you want to highlight this first to sixth disease? Very complicated and very difficult to remember even after so many years of medicine. And but these students may have recently passed the MD medicine. We have passed 20-25 years back, so they may still give you a good answer. So anyone you want to add, sir, this classification? I think we all should raise our hands. It's difficult. Okay, computer will let us know. How many percent? Oh God, sixth disease. So it's a mnemonic type of thing. Correct answer was fifth disease. Rosenia, I think it's called the fifth disease. And computer G has tricked to sixth disease. But 50% of the students were correct. So let's see who is the brilliant student who is still repenting that he has taken medicine instead of pediatrics. Let's have the winner from pediatrics. Dr. Aditi Rao. Most probably she must be a gold medalist from pediatrics during her MBBS days. Congratulations, Dr. Aditi. And she took just 3 seconds. Yes. Great pediatric knowledge, sir. I really appreciate this thing. Difficult thing, and all things. Slap cheek is important. This is seen in this infectiosum, edema infectiosum. But we all more important. We remember edema marginatum and edema nodosum are more important for us compared to infectiosum. So congratulations, all credit to Dr. Aditi, and best of luck to her. She can still be a winner. We still have 37 more questions. We have expert here. Dr. Subha is still with us. For last 4 days, she is here with us. Dr. Moses, we are especially roping for because it's the South zone. So we have expert from South, Dr. Nagaraja, Dr. Moses, and Dr. Ravi was also there. So if Dr. Ravi is there, sir, you should also join us for some expert advice. We would like to have some good advice from you for students. Question number 14, Computer G. Great. So it's a subacute granulomatous thyroiditis is also known as, is it subacute is written? Is it Hashimoto thyroiditis? B is D. Curwen thyroiditis. C. Chronic lymphocytic thyroiditis. And D. Both A and B. Your time starts now. I think as a spotter, you can make it out. Thank you, Computer G. And we have logged the answer. There was a D option where A and B is also there. So Computer G is playing tricks with everyone, even with us. So subacute granulomatous thyroiditis. Computer G will let us know, is it D or something? Okay, Computer G said it's D. Curwen thyroiditis. It's not A and B. It was a trick to make you suspect that it is both A and B. Because A and B both are autoimmune disease, both are related to anti-thyroid antibodies, maybe antibodies against peroxidase, antibody against TPO are positive here. And because it's autoimmune, they will have a longer duration and their prognosis is also poor. While Duquervan, if I remember correctly, it's a subacute onset as well as it's a self-limiting disease. Most of the time, it improves after 2 to 3 months. And antibodies are not very much positive. And anyone of our expert want to add anything on Duquervan thyroiditis or anything about thyroiditis, how to differentiate between thyroiditis leading to increase in hormone versus hyperthyroidism? Because this is important. I personally feel students should be knowing that the thyrotoxicosis versus hyperthyroidism, what is the difference? And clinically or laboratory wise, how can we differentiate this thing?
Clinically diagnosing.
Yes, sir. Go ahead, sir.
Sir. Clinically diagnosing is very, very important. You have to palpate and see for the tenderness. That's a very, very important clinical sign. You can elicit tenderness in these patients. Sometimes they will come with the pain. So many a times we may miss because many viral infections can trigger this. So they may come with throat pain. But if you not palpate the this one neck and look for the tenderness or the thyroid, we may miss it. So clinical examination is very, very important, and it has got a lot of consequence in the treatment. So unnecessarily with elevated thyroid hormones, unnecessarily you may be treating it like an hyperthyroidism. If you suspect clinically it is thyroiditis, so we can wait and see.
Yes, sir. So as sir has told, thyroiditis will cause increase in thyroid hormone T3, T4, and which you may think that it is hyperthyroid or thyroid hormone is in, there is more production of thyroid hormone. So anti-thyroid drug like propyluracil or methimazole and all things are only to be given in patient with hyperthyroidism like Graves' disease. In thyroiditis, is a temporary increase in hormone. You don't have to give any anti-thyroid drug. You just have to give symptomatic treatment with beta blocker. And if someone has fever or a hydration is required. And for proving that it is thyroiditis or destruction of cells, not overproduction of hormone from these cells, you have a radionucleotide scan, which is the gold standard. Although clinically, you can also say Graves' disease will have eye signs, they will have large and large thyroid, they will have other features of Graves' disease. So, and duration, Graves' disease is slightly longer compared to thyroiditis, which is just 2 months or short duration. So, Computer Ji will let us know a good number of students must have answered this thing because thyroiditis is important. And Duke Irwin is, I think, a good name, great name. And exactly 75% of students have answered it correctly, majority of them. And but we will have only one winner who has fastest finger first. I think it will be a very photo finish. Computer Ji must be having very big problem. 250 plus students are just pressing within seconds, and you should give microsecond next time, sir. I will request Computer Ji to not 2 seconds, 3 seconds. It should be 2.220 seconds, something like that, because winner must be very, very short test, I think neck and neck. So we will have a winner, sir, or a madam's Computer Ji. Tejaswini, we have a new winner now again, Dr. Tejaswini. She has answered within 5 seconds, and it must be photo finish. It must be 4.999 seconds, which is rounded off to 5 seconds. I really think because 75% students have correctly answered. And if there are 100 students correctly answering and you have 5 seconds to answer or 20 seconds to answer, there must be 20% in every second, sitting every second. So Computer Ji will have a 15 number question. To go ahead until we have a tie break. A patient presented with fever, myalgia, painful erythematous subcutaneous nodules on the tip of digits, non-tender hemorrhagic macules on the palms or soles and petechiae suggests which of the following? Is it A, infective endocarditis? Is it B, viral myocarditis? Is it C, rheumatic fever? Is it D, toxic myocarditis? Your time starts now. It's the easiest one, maybe 1 second, 2 seconds. Computer Ji is becoming lenient to students. Thank you, Computer Ji. I think this was the one of the easiest for a MD medicine student, even first year, should able to make it out that this is, Computer Ji will tell us, is it A or is it C? Great. So it's A, infective endocarditis, and any of the expert will like to add these lesions they have described. Dr. Subha or Dr. Moses, sir. You want to add something, sir? Or madam?
Yeah, here also, sir, as this question is telling about fever, myalgia, so history and clinical examination. A specific focus should be on history and clinical examination. and then we can make it out whether it is a case of infective endocarditis or not on the basis of these findings. Last question was also like that only, where we have to be more focused on history and clinical findings.
The clinical findings in infective endocarditis are all elaborated in this question. So I think it's very easy to answer this.
We have Dr. Ramesh also from New Delhi. Sir, you want to add something? Why so easy question by Computer Ji?
No, actually, Dr. Ghanshyam, the question is easy, but if you go into the depth of the question, see, it has highlighted 4 important diseases: endocarditis, myocarditis, rheumatic fever. And again, myocarditis is something which is very fulminant when it comes to when the patient comes in the emergency. And endocarditis is maybe a subacute endocarditis we generally see. And of course, these clinical signs which have been mentioned here help in differentiating this particular disease from many others. So basically, it is this question is highlighting the importance of the bedside clinical medicine, and the students who are preparing and who are studying internal medicine, so they should be aware of these signs.
Thank you, Dr. Ramesh. I go with you because one term he's picked up very clearly. It's subacute endocarditis, not infective or acute infective endocarditis, because these features which here are there, which is not very acute. There may be like Genevieve lesion, which are there in hands, which is embolic phenomena, palms and soles, while tip of the finger is called, I think, osseous nodule, which are usually immune complex disease, which will occur in a subacute condition of an infective endocarditis. So clinical and features and patient who already have a defective wall or a prosthetic wall should be inquired, and so that you don't have to go wait for viral or toxic myocarditis DD, and you can answer within 1 to 2 seconds. So let's see how many % of the students have answered within 1 to 2 seconds. Computer Ji will let us know. Computer Ji, answer to question number 615. As I said, and everyone said, 78% majority of students were correct. And yeah, some of the students still feel that it may be a rheumatic fever because these two entities are the commonly asked by examiners, traditional teaching, while viral and toxic myocarditis is not a common DD as such. Computer Ji will let us know how fast was the answering by Dr. Vishnu. Dr. Vishnu has taken just 4 seconds to answer this. Great. Congratulations, Dr. Vishnu. And he is another winner in the line of taking the trophy for South Zone. Still have 5 questions. He can still be a part of our first and winner and second, first runner-up. Computer Ji, we can have 16 number question. And 16 number question is the most common cell line used for ANA testing by immunofluorescence. So here comes some autoimmune testing is a laboratory thing, slightly difficult. Is it HeLa cell line is most commonly used? It's just asking commonly. HEP 2000 cell line, is it HEP2 cell line, or is it rodent liver cell line? Your time starts now. It's asking commonly used. Computer Ji, time starts now. Not famous, it's asking commonly. Thank you, Computer Ji, and we can have answer first. We can discuss HeLa line. We have been giving these testing for SLE patient ANA testing. Computer Ji will first answer the query. Is it HeLa cell line or HEP2 cell line? Okay, so most of the testing when you do ANA, you must be seeing HEP2 cell line commonly raised. So question was most common cell line. And if you remember, HeLa cell line is very famous. If you go to history, I think this HE is initial of some patient who was suffering from some malignancy, most probably I think invasive cervical cancer. Our cell line are still being used. It is being used for making those cell lines, and they are mutated so many times, and they are immortal now. But they are not used routinely in lab. Commonly used is HEP2 cell line, and any of the expert will like to add what are the other tests like ELISA and all? They are also being used for ANA testing. But some people say ki we'll go with traditional and most common thing, Hep2 cell line.
Dr. Ghanshyam, see, what we really see in the real practice is that ELISA is very readily available for testing this ANA, but immunofluorescence is actually the better and the gold standard test for detecting ANA. So it often happens that when we go for this ELISA test for ANA, it maybe sometimes becomes negative, but if we do it by immunofluorescence, it comes positive. But you are the expert probably in this field, and you will be better able to answer that. If it comes positive, say it's a mild level, so should we further investigate the patient or should we rest that patient for some time?
Yeah, it's $1 million question, very difficult to answer. But still, the practical thing I will just like to highlight to students. Both the tests are good if done with a good appropriate lab. The lab accredited lab. If you have an ISO lab, you can have a NABH accredited lab, so that reports should be reliable. So both Hep2 cell line as well as ELISA are good sensitivity. So it's not that only ELISA is important. So clinically, if you suspect SLE disease, patient has Mallarus, patient has kidney involvement in the form of active sediments, renal involvements. There may be serositis, you may have pleural effusion and other thing, and you got a Hep2 cell line negative, use immunofluorescence. You should go for another method, ELISA. This is appropriate. And if you get positive, you correlate it with clinically that it is SLE, maybe because of some reason. Otherwise, best is again repeat the immunofluorescence test. Sometimes there may be a diluting method, maybe improperly done by a technician, there may be issue. So clinical suspicion is there. But if it is negative by ELISA, if it is negative by Hep2 multiple times, and you still feel it is SLE only, 97% of the patient will have either of the method will be positive. So only there are 3% of the patient may still have a ANA negative SLE. So we practically follow either of them, we'll get it done. If we think very strongly that it is SLE, we try to get it with another method. And both method we feel is a good method. If, especially lab should be a appropriate lab. HeLa cell line I told you, but if I read something about Hep2, it is from the mouse human epidermal tumor cell lines are there, which are injected in mouse, and these cell lines are taken there, and it is commercially used most commonly. So computer ji will let us know. I think Hep2 cell line majority will be correct answer. C answer 78% correctly, Hep2 cell line. If you see a lot of big labs, they use Hep2 cell lines. Clearly, they say Hep2 immunofluorescence, indirect immunofluorescence test. And can we have the winner also for question number 16? Dr. Nidhi, okay, I think she is coming first time to the podium. She took just 5 seconds to answer and correctly said Hep2 cell lines are the most commonly used. But if you say most HeLa cell lines are the big B of these immunofluorescence tests. Everyone knows about HeLa cell lines. I'm forgetting her first name, Henrique something was her first name. You can Google it, and a lot of students may be on Google and they can just let us know later what is exactly HeLa stands for. But that was not the answer. We'll go for question number 17. So we have only 3 more questions for this South Zone quiz, zonal quiz. Again, a negative STEM question. Incorrect statement about asymptomatic bacteriuria. Is it quantitative count of less than 10 to the power 5? It's not 105. It's 10 to the power 5 CFU per ml. Is it no symptoms of urinary tract infection? C is prevalence is higher in females. Asymptomatic bacteriuria screening not required for premenopausal non-pregnant women, maybe diabetic women. Your time starts now. Incorrect statement, false statement. Okay, Computer ji, thank you. And I think again negative STEM question, and I feel the 10 to the power 5 may have something to do, or 105, especially Computer ji is tried to make it clearly something is abnormal there. Computer ji, first answer the question of question number 17. Okay, it's 10 to the power 5, not 105 CFU per ml. So it is a false statement. We all know bacteremia, if it is more than 10 to the power 5 or 10 to the power 6 is significant. So that's why this was the negative STEM. Prevalence is higher in females, and no symptoms of urinary tract is usually its term also suggests asymptomatic. Very common problem in our medical practice. Any of our expert will like to tell us about asymptomatic bacteria, when we should treat and when we should be thinking about it should be more evaluated. Any of the expert want to add, sir? Asymptomatic bacteria. Dr. Shubha want to add something?
Yeah, sir. It is not very uncommon as we feel, because patients are asymptomatic and we never come to know that they are having this asymptomatic bacteria. So almost percentage-wise, if we talk, it is around 15%. And as it is written, the prevalence is higher in females and it increases with age. So any female with more than 65 or this thing, age are more common for this thing. But here it is written, it is non-pregnant women who should not be screened. So pregnant women should be screened and should be treated if found to be positive. Bacteria is present in them. They are asymptomatic, but should be treated. So treatment should be offered only in few conditions, like one is this pregnant females. Other is if the patient is going for any urological surgery. Otherwise, no treatment is required because the patient will not be benefited by that. So this is very important topic and should be known by the students because patients are asymptomatic. So that's all for my side, sir.
Yeah, again, Dr. Ghanshyam, like this question has again been coming, similar questions for the last 3 days. So it itself tells the importance of the particular topic UTI. Now, yesterday there was like catheter-associated UTIs. So yeah, in that the count was less than 10 to the power 3. And today we have the question in which the count is less than 10 to the power 5. And both complicated UTIs and uncomplicated UTIs, especially UTI in men, that should be read by the students. Yeah, that's from my side.
Okay, so we all should remember that asymptomatic bacteria is a problem, especially in pregnant female. If you are doing a urethral or a urinary intervention, you should have a sterile urine there. Even this bacteria should not be there. And maybe immunocompromised patient also may create some problem. There also you may have to require some treatment. And we can have a percentage distribution. I think this will be a majority of students who must have correctly answered. Okay, so borderline 48%, but still is the majority. I will give full credit to our students who are continuously clicking fastest finger first and the correct answer also. Okay, so wrong answer, fastest finger will not help them, and correct answer will help them, and 48% has chances of getting this correct answer number 17. Computer G, can we have the answer 17? Great, we have another new winner with Dr. Vineshri Harsur, and by name I will be very difficult to say is it she or he, but congratulations, Dr. Saab. You won the question number 17 and you just took 2 seconds. Great, congratulations. And you still have chances. I think best topper of this quiz still are stuck at 2 correct answers. So anyone having one more correct answer will be a winner, straight winner, not tiebreaker. So we'll go for question number 18. Computer G. Vineshri Harsur was the winner for question number 17. Computer G is just noting who are the fastest finger first there for last 17 questions. So which of the following drugs was approved by FDA in 2021 for African trypanosomiasis? Is it cabotegravir? A. Is it B. Melphalan? Is it C. Fexinidazole? Is it D. Belumosudil? Your time starts now. It's a difficult question. Recent invention. also called, I think, sleeping sickness. Thank you, Computer Ji. So there are 4 drugs. I think Melphalan everyone must have heard, but rest of the 3 are new drug. And we don't know is it for active against African trypanosomiasis. First, Computer Ji will let us know which one of them is approved by FDA, US FDA. Pexinidazole. Okay, so something to do with the azole drug. So it is most likely a group of same tinidazole and metronidazole group, so which call it nitroimidazole group. And as per some data which we have reviewed, we suggest that it is an oral drug, and it has been recently approved. And these are the diseases in a poor country like ours, and these are called rare and neglected disease. And very few developed countries and pharmaceutical companies are ready to push money and R&I of these treatment. So these are the people of poor countries suffer because of these diseases. But good thing is that pexinidazole is approved, and it's a cheap oral drug similar to tinidazole group. And I think it's a 10-day therapy. Rest of the drug, if you will review cabotegravir, I think it is an anti-HIV drug. It is used for, I think, pre-exposure prophylaxis of HIV. And belumosudil may be used for any of the expert will like to add Melphalan and belumosudil. I think belumosudil was also recently new drug, and it is we have to search it. Melphalan is used and alkylating agent. Multiple myeloma we use it. Belumosudil, I don't know. Computer Ji will let us know after the quiz maybe. Let's have the percentage distribution. Difficult answer C. We'll see how many are correctly answered. C. Okay, 50% of the student knows. So it's a good invention, cheap invention, and oral drug for African trypanosomiasis, which can cause Chagas disease or heart involvement. So good thing is there some company and R&I or maybe a WHO are pushing some money to these poor countries, and some of the patient may improve with this treatment. And a good thing is it's not common in India, so we are safe from this, and we don't need this drug. And let's see who is the winner for this difficult question. Dr. Harsha Varthni, she is a new entry, and she has just answered in 3 seconds a new drug, and she has correctly answered within 3 seconds, and she has answered C option. Okay, next question. We have now 2 only questions, and we have to select 1 winner and 1 runner-up. And we are crossed 1 hour plus 15 minutes of quiz. Computer Ji, let's start with 2 last questions. Okay, so fever quiz, South Zone, second last question. Which of the following is an appropriate step in management of febrile neutropenia persisting even after 4 days of antibiotics? So someone has febrile neutropenia and fever is still persisting 4 days. You will add colistin as a option. You will add antiviral as a second option. C is consider possibility of drug-related fever, or D, add an antifungal. Your time starts now. Febrile neutropenia. Time is over, and it was a 19th question, penultimate question, and option looks like slightly easier for medicine PG. Should be easy to pick it up. We will first log the question so that computer can do analysis of last 19 questions. Computer Ji, give us the answer. It's add antifungal. So we all know that initially we give a beta-lactam broad spectrum, which covers positive as well as negative cover. And some people will add maybe a MRSA cover after that. And then comes the antifungal, which is very appropriate. Everyone has a different SOP or protocol which day. And this protocol says 4 days. Any of our experts want to add something which antifungal? It's very complicated. So many antifungals are there. So many fungus. Antifungal doesn't work on all antifungals. So which day, 4-day, you all giving this in your practice, ICU and critical patient, febrile neutropenia, counts less than 500, ANC. Anyone wants to add some points, sir? Okay. Dr. Ramesh, want to add something, sir?
Dr. Ghanshyam, again, as you said, that there are so many antifungals, depends on the antibiotic and the antifungal policy of the ICUs. Capsifungin is generally added after 4 or 5 days if the patient is not responding to your treatment. And of course, if you look at the choice C, a neutropenia doesn't come with the drug fever. So actually that goes out, and antiviral is not an option with the febrile neutropenia. So the best choice was antifungal, and of course, it will depend on the hospital policy, what they're advocating for the use of antifungal.
Exactly. Dr. Ramesh has already said that antifungal caspofungin is a good broad spectrum antibiotic. Initially, when these guidelines were made, and amphotericin B was the most commonly used drug. But nowadays, a lot of voriconazole, caspofungin are there. So it all depends what common fungal infection are going on in their institute. And accordingly, also protocol and these some of the antifungals are very costly. So if someone wants to give some antifungal and affordability is an issue, then protocol does help us. We have to give this thing, and most of the ICU will follow this thing. And 51% of the students have correctly answered. And can we have the winner for this penultimate question? Dr. Vishnu, I think you are the seen previously also. I don't remember it's 2 times or 3 times. But best of luck to you. You have a good chance of winning this quiz. You have answered in 4 seconds. Congratulations. And we will go for the last climax question, 20 number question. And if we have a tie break for position 1 or position 2, we will have to run 3 more questions after that. But I hope this will lead to the first winner for South Zone quiz. Computer G, can we have the final question? Okay, so drug of choice for treatment of pertussis, again a pediatric disease more commonly, but it can be seen in adults. Is it fluoroquinolone? Is it macrolides? Is it aminoglycoside? Is it tetracycline? Your time starts now. Drug of choice to treat pertussis bacterial infection. Computer G, time starts now. He has given few more seconds, so I think we will have a very shortest answer to this question. Maybe 1 second. Or computer also become tired. Okay, thank you, Computer Ji. We have completed 20 questions, and this was again slightly not commonly seen in our practice. Whooping cough is pertussis. And let's see the answer first, or let's see answer, because Computer G also become tired. Okay, so answer is macrolides. So macrolide antibiotics, you all know azithromycin. Azithromycin is very rarely used. Most commonly used macrolide is azithro. It is, as per Computer G, it is effective. We all, I think pediatrics population already know, and today physician also will be knowing that macrolides can be given for whooping cough. And any of the expert want to add who's seen whooping cough in pediatrics rounds, or maybe their practice adult whooping cough? I have not seen.
Actually, this is a disease of pediatrics only. A few months old children usually present with this, and it is very violent cough. So parents are actually, it is dreadful and scary for the parents to see that whooping type of cough. So early treatment is very important in this whooping cough. So if physician also know, they can also advise. So it is good that we all should also be knowing about this whooping cough. Okay. Because early treatment is most effective in these patients in reducing the symptoms.
Yeah, exactly. Like 3, I think macrolide is being used. So what I have read somewhere that If you don't treat this thing, it can be fatal also, because this causes inflammation of the respiratory tract, and this can cause dyspnea or asphyxia. And but whoever survived 3 weeks of illness, this bacteria get destroyed on its own. So if you want to treat, really treat as early as possible, so that there is no fatality. And we all know infection, as early as possible we should treat with antibiotics, especially bacterial infection, not viral infection. For students, please, postgraduate, don't treat antibiotics, viral URI and all, only for bacterial infections. And there's a membrane also during whooping cough. You can have a membrane for detection, but only pediatrics. So Computer Ji will let us know how many percent of the students were able to guess the antibiotic macrolides. Option was B, correct answer. And our student majority will be giving correct answer, because this is the 2 drugs which are 3 drug oral drug. Computer Ji, answer.
Percentage of student having correct answers, sir.
Computer Ji, answer de do. Yeah, so correct answer, macrolide correctly, 54% of the students have correctly answered. Azithromycin, very commonly used in URI, especially bacterial URI. So we can have the winner also for last question, and Computer Ji is already engaged in doing calculation, I think. So Siddharth Raghu, I can remember he was there previously also. So congratulations, Dr. Siddharth, you just took 4 seconds. And best of luck to everyone, and compliments to everyone whoever has participated this quiz. And now I will hand over the stage to Fever Foundation team and Computer Ji to do calculation and let us know the winner. And if we still have to continue with tiebreaker, we will know in next maybe 2 to 3 minutes, ma'am. Dr.
Yes,
Manjula,
sir. Yes, sir. Thank you. If anyone wants to comment, our panel of judges and quiz master, otherwise I'll make announcement about case report. If anyone wants to comment, please go ahead.
Well, I will just like to add, if I have the permission, Dr.
Yes,
Moses,
sir.
Dr. Nagraj. The last question was indeed interesting, but I would just say that with increasing vaccination, because diphtheria, pertussis, tetanus, they were all actually very significant causes of under 5 and under 1 mortality, infant mortality, under 5 mortality. And with vaccination coverage, this has actually come drastically down. We were staring at an infant mortality rate of 110, 130 a few decades back, just after independence. And now it has come down to 37, I believe, and maybe it must have come much lower. But the problem is that the lifespan longevity has also increased. So what is happening is, now earlier the average lifespan was 55. When we got independence, it was roughly around about that age only. But now it is now 70 plus that we have an average lifespan. So what is happening is, the immunity that was conferred to children now starts waning in the elderly. So these diseases like diphtheria, pertussis, they are now increasingly being seen in those who are elderly. So maybe around 60, 70, more than 70 years of age. So there have been cases now which are coming up in the age which is now elderly population. So geriatric medicine people and those who are general practitioners need to be very careful about this. Number 2, when we talk of the DPT vaccination, we should remember that pertussis vaccination, obviously the question was not about vaccination, but yes, pertussis vaccination has a whole lot of neuropsychiatric manifestations. In fact, it can also result in severe headache, irritability, and in rare conditions, it can be really at times seizures, etc. may be witnessed. And in fact, it is so immunogenic that it does cause a high degree of fever. So fever, irritability, the child may refuse to take feeds. All those things are actually seen after DPT vaccination. But yes, now we have an acellular pertussis vaccine. So the DPT is now DA-AP, that is an acellular pertussis vaccine which is used and which does not have these side effects. So the child is not irritable, the patient is not having fever. So these things are important, I think, because the discussion was that adults are not aware of it. So adults need to be aware of it. Number one, because the incidence can come not only for these diseases, but those diseases which you give immunization. Similarly, for chicken pox, people used to have natural immunity for varicella, chicken pox. And so they got it somewhere during their adolescence or early childhood or toddler age group. So what happened was they never had till the age of 60, 70 years. But now people are living till 75, 80, 85, 90 years, and they get vaccinated as part of the immunization program early in the first 5 years. So that immunity actually wanes off, and people are increasingly having chickenpox in the geriatric age group. So these are things which an adult physician, especially if you are catering to elderly population, these things need to be taken care of. And these are very, 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 very important, because we should understand that with every intervention, the disease spectrum also changes over a period of time. So what we were studying 50 years back may not be true today. Just like we are having re-emerging infectious diseases, we have had three coronavirus type illnesses in the last 2 decades. MERS, SARS-CoV, MERS, and SARS-CoV-2 now. So we all need to be careful about these things. And I just thought it is not related to the questionnaires, but I just thought that I will make this point because the audience needs to be aware of all these things. In fact, those who are in the south, they are every now and then Nipah outbreak, Castor foreign disease in Karnataka, Nipah in Kerala, and all those keep coming on time and again. And Kerala is a hot spot. So we have to be very, very careful about febrile illnesses and all these emerging new diseases also. Well, thank you. I will rest my voice here. Thank you.
Thank you very much, sir. I thank all our panelists and judges for such an interesting and very, I think, interactive quiz we have among yourself. It was wonderful. And I also thank the participants for having come and played the quiz. And all our winners, our IT team is compiling the data. So they need some time. With this few minutes, I would like to make another announcement from Fever Foundation. We are having a poster presentation competition. So this is another scientific event which we are going to be after this. Like last year, we are having the poster presentation competition. This is basically to address the gaps and provide information in research, education, and therapy. And this is in continuation with our FEFCON. FEFCON 22 is planned on 5th and 6th November in Bangalore. So FEFCON 2022 Scientific Committee inviting all the doctors, postgraduates, as well as this is for practicing clinician, for an opportunity to exchange and share their experience in fever management. And we are now accepting the presentation, poster presentation in the format which is attached. When you get the link, you will find a PPT slide. So you need to, we are accepting only electronic form of posters, and the poster should be in 16:9 ratio, like that's a widescreen PPT. So one poster is one single slide only. Sample pictures are given below. Research template format and case study. You can download these formats from the link which you receive for registration. And only if you are submitting in the slide format, it is accepted. We don't accept any hard copy of poster, nor the photo taken a picture of hard copy. So it's not accepted. Only one slide PPT is accepted. Coming on to other rules of these, some guidelines which we need to follow. So as I just now mentioned, we are accepting electronic posters only in PPT format, and printed poster or photographs of the printed poster not allowed, and topic should be related to fever. So you are, it can be case-based or research-based, but it has to be related to fever. And participation, you will have a drop-down button where while submitting, you can select is it case study or original research paper. And our scientific committee will screen all the application. They're going to select 10 applications, so they will be asked to make the presentation. Only the first author will be allowed to present the paper. And also please note that poster to be submitted in the as per the template, one single slide PPT, and for title, the word limit should be 15. Along with a single slide PPT format, please also you need to submit an article in the Word format, which is maximum of 500 words. The article format will be similar to JAPI, which is Official Journal of Association of Physicians of India, And the acceptance of the poster presentation will be entirely at the discretion of our scientific committee, and their decision is binding. So we need to follow whatever the decisions they are telling. So we need to accept their decision. So these are some of the rules, and the last date for entry of this poster is October 16th. So if you have any further queries, please you can mail it to us at feverfoundation@gmail.com, and all participant will get a participation certificate and will not get the attractive prize. And also all the posters which are selected will be exhibited in the dedicated poster presentation hall in the FEFCON 22 on the virtual platform. So these are some of the announcements. If you want more information, you can write to us feverfoundation@gmail.com. So I request all of you to participate, and we will be sending to your respective departments, HOD also, about the information about poster presentation. So now I think our IT team is ready with the winners, but I must say that all of you are winners. Participation, as our panel members always say, that participation is itself is winning. It's only one or two has to win, so they will be, but all of you are in your own way winners, and all of you will get the participation certificate for having participated in the quiz. Okay. So I hand over to our eminent judges to make the announcement, whether it is a clear winner or we are going for the tie, or we have to go for a tie break or anything. Over to you, sir. Over to our quiz master and judges to announce the winners. So if our IT team is ready, they can display.
Dr. Moses and Dr. Nagaraj can display.
Yeah, please, one of you tell the. Okay, we have the clear winners. No tie break. Yeah.
Dr. Vishnu is from our college, Coimbatore Medical College.
Oh, sir. Okay.
And Siddharth is from our college.
Oh, Bangalore Medical College. Okay.
Congratulations. So Dr. Moses and Dr. Nagaraj will give everybody a party now.
Yeah.
So congratulations, Dr. Vishnu and Dr. Siddharth. So you will be coming to Bangalore. Anyway, Siddharth is in Bangalore only. So Dr. Vishnu, our Fever Foundation team will contact you. You will be playing as a team along with Dr. Siddharth. So you will represent South Zone team, and you will compete in the other zones for the national level competition. So the detail will be shared by our Fever Foundation team, who will get in touch with you. Congratulations, Dr. Vishnu and Dr. Siddharth. Well played. And anything of final comments by our experts?
I wish to congratulate Dr. Ganesham and Dr. Anupam for conducting it so excellently. They are organized very nicely. Congratulations to both of you, sir. Well done.
Yes, sir.
Yes.
Entire team, sir.
The recording is off.
No,
recording is still on, sir.
Thank you, participants. Thank you so much. And congrats to everybody.
Congratulations to Dr. Siddharth and Dr.
Thank you, sir.
Vishnu.
Thank you very much.
And thanks to all the experts, Dr. Ramesh, Dr. Subbalakshmi, Dr. Nagaraj, Dr. Ishak, Dr. Anupam. These are the experts which helped us in running this show in time and with so much of interest also. So, and congratulations to all the participants also. And I think whoever is in Bangalore, they can join us physically, even from the audience, and prizes will be there from audience also.
Well, I have raised my hand. I want to say something if I am permitted.
Yes, sir. Recording has stopped, so you can take anything.
So,
you can
I am not taking any congratulations.
Madam, recording has stopped.
Yes.